Hello. Namaste and good evening to all. Nityam Hidahara Vihara Sevi, Samikshakari Visheshu Asakta, Dada Sama Satyapara Kshamavan, Aptoba Sevi Cha Bhavatyaroga. One who resorts to wholesome food and regimen is objective, apathetic to sensual affairs, straightforward, honest, patient, and who upholds the values of seldom gets afflicted with diseases. With this verse from Ashtanga Hridaya, which gives an in-depth perspective on the physical, mental, social, and spiritual aspects of health, we begin this webinar on Ayurveda, organized by the Department of Ayush, Government of Kerala. Ayurveda in Kerala is unique due to the judicious blend of indigenous practices and scientific treatment protocols. Kerala Ayurveda has gained widespread acceptance and recognition across the world. Several authentic Ayurvedic treatises, which originated in this land, are widely acknowledged and appreciated by the global Ayurvedic fraternity. Swasthya 2021 examines, deliberates, and discusses various perspectives and prospects of Ayurveda in public health domains. The focus of the discussion would be the role of Ayurveda in health and wellness, non-communicable diseases, pain and palliative care, and geriatric care. Without taking much of your time, let's begin with the inaugural session. I now request Dr. Sharmila Mary Joseph, IAS, Secretary, Department of Ayush, Government of Kerala, to deliver the welcome address for the session. The Ayush Department has been coordinating all preparatory activities for organizing this webinar for quite some time now. So we welcome ma'am.
Good evening, ladies and gentlemen. Honorable Minister for Health, Kerala, Srimati Shailaja Teacher, Secretary, Ministry of Ayush, Government of India, Padmasri Vaidya Rajesh Kotecha-ji, Principal Secretary, Health and Family Welfare, Government of Kerala, Dr. Rajan Kopragade, State Mission Director, National Ayush Mission, Dr. Divya S. Iyer, other dignitaries, speakers, ladies and gentlemen, and dear friends. God's own country, Kerala, is known all over the world, not just for its beaches and lakes, its hills and valleys, its rivers and brooks, its trees and greenery, its scenic climate, rich culture and tasty cuisine, but also for its achievements in the social, developmental, and health fronts. The gains made by the state in various facets of human development, in providing education to its people, and in ensuring the health of its people are noteworthy. Our achievements or results vis-à-vis the various goals and indicators listed out in the Sustainable Development Framework Matrix are comparable with the achievements of even the developed countries of the West. These achievements in the health sector can be rightly attributed to the effective public health interventions of the state government and the decentralized pattern of service delivery at the grassroots through the public health machinery, both in the modern medicine and alternative medicine sectors and the private sector too. The Ayush Department Kerala has organized this webinar today, christened Swasthya 2021, to showcase the potential of Kerala Ayurveda, particularly in the areas of health and wellness, non-communicable diseases, geriatric care, and pain and palliative care. As we would be discussing in the subsequent presentations, health is not merely absence of disease. It encompasses a wider context of physical, mental, and social well-being of the individuals. Good health can be achieved and maintained by individuals if they follow the principles of healthy living, healthy eating, good exercise, abstinence from drugs and alcohol, cleanliness, and health-seeking behavior. These are the principles incidentally enshrined in Our Health, Our Responsibility campaign and principle of the Government of Kerala. May I now proceed to my assigned task. I have great pleasure in welcoming our Honorable Health Minister, Madam K.K. Shailaji Teacher, to the inaugural session of this webinar. Madam Health Minister has been guiding the Departments of Health, Ayush and Social Welfare for the last 5 years. With her commitment and able leadership, she has been able to transform the health sector of the state. Our primary health centers have been transformed to family health centers. Our health institutions now boast of the best infrastructure. Our minister has also been leading the COVID war brigade of the state. The clear guidelines issued by the department and the proper implementation of these guidelines have ensured that the COVID fatality rate in the state was kept under check and that there was no large-scale community spread. The Ayush sector is also quite dear to her heart, as seen from the budgetary support given to the sector. On behalf of the Ayush department and all of us present here, I am extremely happy to welcome our dear and honorable minister to this webinar. The keynote address of this webinar will be given by Vaidya Rajesh Koteja ji, Secretary, Ministry of Ayush, Government of India. It would not be an exaggeration if I say that the Ayush sector in the country has seen a phenomenal leap during the tenure of Vaidya Koteja ji. Sir comes from the Ayurveda fraternity. The policy prescriptions of the ministry have therefore been fine-tuned, taking into account the field realities and giving due consideration to Ayurvedic science. The commemoration of Ayurveda Day and Yoga Day and other events have sent the message to the public about prescriptions for healthy living. Sir, we are indeed honored that you have found time to join us on this webinar for the keynote address. I heartily extend you a very warm welcome. Principal Secretary Health, Government of Kerala, Dr. Rajan Khopragade, needs no introduction to this audience. Dr. Khopragade has been spearheading the COVID-related activities of the state for the last 1 year. Sir displays a level of energy and enthusiasm which keeps his team going. It is Dr. Khopragade who took the lead in organizing the webinar series on health, making SDG a reality. The Ayush webinar being held as part of this series has also been conceptualized by Dr. Khopragade with a view to firmly position brand Kerala Ayurveda in the global milieu. Sir, I warmly welcome you to this event. Today, in the scientific sessions, we have, among other speakers, Sri P.K. Pathak, who is Additional Secretary in the Ministry of Ayush, Government of Kerala. Sri Pathak is from Kerala cadre and has seen and experienced for himself the brand value of Kerala Ayurveda. Pathak sir is in charge of Ayush education and international collaboration at the ministry. The ministry has already entered into collaborations with many other countries for expanding the outreach of Ayurveda. Sir, it is my pleasure to extend you a very warm welcome to this event. I am also happy to extend a hearty welcome to all the distinguished speakers of the scientific sessions and the panels. They are all stalwarts in their fields with rich professional experience in Ayurveda. I would like to make a special mention about Dr. P.M. Warrior of Kottakkal Arya Vaidishala. Kottakkal, if I may say so, has been instrumental in keeping the Kerala brand of Ayurveda high and flying. We are fortunate that Dr. P.M. Warrior and Dr. Ramesh from Arya Vaidishala Kottakkal are joining us today. We also have other experts, Dr. Hadar, Dr. Mangala Gauri Rao, who are speakers at today's session. In the panel, we have Dr. Krishnan Payapalli as moderator for the discussion on Kerala Ayurveda in global health, Dr. Hemant Nutalapati, research administrator from Shimani University, and other experts. Academic collaborations are important to streamline Ayurvedic research and for setting a broad framework for systematic data collection and analysis. I welcome all of them to the event. I now take the opportunity to welcome my team. Although they do not need any formal welcome, I would be failing in my duty if I do not make a specific mention, a special mention of Dr. Divya Iyer, State Mission Director, NAM, who has been attending to the nitty-gritties of the seminar, of this webinar from day one to ensure that the event is organized well. I welcome Divya to the event. I welcome the entire Ayush team, the directors of the departments, my scientific team led by Dr. Rajmohan, the IT team in Ayush led by Mr. Shashikumar, Dr. J. Narayanan, the team from CDIT, IT Mission, and all others who have worked hard to organize this event. A warm welcome to one and all. Thank you.
Thank you, ma'am, for the warm welcome address. May I now invite Dr. Rajan Kobragade, IAS, Principal Secretary, Department of Health and Family Welfare, Government of Kerala, to deliver the opening remarks. Dr. Kobragade, a medical doctor by academic training and an IAS officer of the 1993 batch, is the key person for organizing this event as well as the webinar series on health, making SDG a reality. Welcome, sir.
Thank you. Thank you, Sharmila, for introducing our session to everybody. So, good morning, good afternoon, and good evening, because there are many others who are joining from various parts of our the world in this event. Briefly, I will tell few things under our Honorable Minister's guidance. We are organizing this webinar, Kerala Health Making the SDG Reality. Our Honorable Health Minister, Madam K.K. Shailaja Teacher, our Secretary, Government of India, Vaidya, Shriman Rajesh Katocha Sir, my esteemed colleagues, Dr. Sharmila, Dr. Divya, and everybody who are present in this today's session. The idea of this webinar is to learn from the success stories all across the world. So when we had a discussion with our Honorable Minister, we decided that we will have the format which will be all inclusive. So our nomenclature itself will reflect that it is not only the story of modern medicine, but it is also inclusive of the strengths of Kerala, that is Ayurveda and other systems what we very seriously follow in our state. That is why we have given the nomenclature Kerala Health, making the SDG a reality. Because health is all encompassing. It touches each and every person. And we are having methods, we are having systems by which we ensure that a healthy person will be a productive asset. In Kerala, we know that we are having some of the fundamental principles with which we work. We believe firmly that the only resource one is having, there are two resources. One is human resource and second is time. So all our policies are guided by how best we should invest the time to ensure that our human resource will be performing at the highest level of performance. And if we have to do that, we have to ensure that each one is a healthy individual. So healthy individual and healthy mind will always have a very progressive thinking, and with that we will turn into a knowledge society and we will be all going towards a path of development. So with these, some of these fundamental principles, when we build the systems in the state, definitely these systems are not only built by the only government structures, but it requires public action at the grassroots level. And that is what we are standing in front of you today to share our experience, that what are the public policies which are shaped by our very pragmatic Honorable Chief Minister, Honorable Health Minister, and also converting those pragmatic policies into the action plan and implementing at the grassroots level. That is what we are trying to put forward before all of you. So I am indeed very happy that we have not focused only on the modern medicine, but we have brought on the floor the strengths of Kerala in Ayurveda. Now, few things what we would like to achieve. One, as Sharmila has said, the strengths of Kerala are all well known, not only in the state, in the country, but all over the world. But what we are looking forward to, if there are other parts of the world interested in Ayurveda as a system of medicine, which is focusing at health and well-being, which is focusing at geriatric care, which is focusing at pain and palliative care, then let me assure you that this system is one of the best complementary or even the primary healthcare approach for tackling these issues, which is proven for last so many years. By the nature's law, in fact, whatever is sustainable is continuing, in fact, and whatever is in disuse vanishes. Even the part of our body also vanishes. That is what, in fact, we have seen by the Darwin's law. But the system of medicine, which is for last 2,000, 3,000 years is surviving, so that itself establishes that there is a strength in this system, and we need to look at this system that in what way we will be using it at a macro level. So with this thought process, what we are putting forward and our proposal is, wherever within the country, within the state and even outside the country, if there is some kind of enthusiasm to understand this system, Kerala Ayush will be always on a forefront to provide that support, or we will have a collaboration. So what we are looking at as an output from this, that if there are any kind of inquiries or if there are any kind of proposals which are coming forward, we will definitely have a discussion with our seniors in Government of India. But with Madam's permission and with the government's permission, we will have a coordinated effort all across wherever we would like to take Ayurveda forward. Last point I would like to mention here is, there is an integrative medicine system which we are rolling it out. Katocha sir is all a part of that. Dr. V.K. Paul is a chairman of that committee, and we are very happy, ma'am. In fact, Kerala also has been taken as a member, and on behalf of Kerala, I participate in that national committee, and discussions are going on in what way we can integrate the systems together. So the way we have rolled out under the guidance of our Honorable Chief Minister and Health Minister, that we do interventions at the infrastructure level, but more than infrastructure level, I will dwell upon the functional aspect. So if we have to tackle non-communicable diseases, there is nothing more important than bringing in convergence with Ayush, bringing in convergence with Ayurveda, so that we can tackle that very effectively. If we have to take a look at the school health education program, there is nothing more important than to bring in yoga and other healthy food habits from the part of the Ayush repertory, what we are having, and extend it. And every thinking mind, the student age itself will realize what they eat is very, very important, and therefore in a long term, they will definitely understand the very basic principle of eating healthy and keeping themselves fit is the best thing what they can give it to themselves. So with these few words, in fact, there are exciting sessions ahead. So I will not stand between you and our Honorable Chief Minister's inaugural address and our esteemed Secretary from Government of India's address. So with these few words, I will stop here, and at this outset, I will congratulate Dr. Divya, Dr. Sharmila and whole team who have been working to organize this webinar to be a grand success, and I wish this webinar will achieve its objective. Thank you very much.
Thank you, sir, for your valuable remarks. We are greatly privileged to welcome Honorable Minister of Health, Family Welfare and Social Justice, Government of Kerala, Srimati K.K. Shailaja Teacher, for the inaugural address. Honorable Minister is highly regarded for her unwavering commitment to Kerala health. She was one among several leaders across the world invited to speak on the occasion of United Nations Public Service Day for her yeoman efforts in the fight against coronavirus pandemic. She has been leading Kerala's COVID containment efforts for the last 1 year and continue to instill confidence in her team. We welcome you, ma'am, to inaugurate the session and to deliver the inaugural speech.
Dear friends, I want to express my proud and pleasure to participate in this webinar in which so many eminent personalities are participating as speakers. Thank you, Mr. Rajesh Koteja ji and the eminent speakers throughout the world. And I have with me our Health Secretary Rajan Kobragade IAS, Ayush Secretary Sharmila Mary Joseph IAS, and also our NAM SMD Divya IAS. We are discussing about indigenous medicine, especially Ayush, especially Ayurveda. And I can say that the future is for Ayurveda because we are fighting against two enemies in health sector. One is the epidemic or the pandemic due to the infectious disease such as COVID-19, and the other enemy is the lifestyle diseases. As throughout the world, the human beings are thinking how to contain this infectious disease and also how to improve the lifestyle of the human being to make a beautiful life or make the health sector beautiful. We are also thinking about that. As we all know, in most of the indices, health indices, comparing to other parts of our country, Kerala has a better position. But we have so many challenges too. That is from lifestyle diseases, especially from lifestyle diseases. Diabetes mellitus, cancer, and all other lifestyle diseases are rampant here also. We are now thinking about one health approach. Then only we can achieve good result in health sector. We should have a balanced approach. We should have to think about each and every creatures in the world and also every life situation in the world. And that is why we are thinking about a comprehensive approach and also an integrative approach in health sector. The integration of several schools of treatment, that is the much important thing throughout the world. In Kerala also we are trying to do so. We have a very good Ayush tradition in Kerala. Especially in Ayurveda, we have a traditional wealth in Kerala, we can say so. So many eminent acharyas were here in India and also in Kerala. There is a saying that eminent acharya of Ayurveda, Vagbada, came India from Sindh, came to Kerala from Sindh provincia, that part of world, in search of good herbs for making medicine. When he reached Kerala, he found a good wealth of medicinal herbs in Kerala, and he stayed here and he studied about that and he taught about the treatment and about the herbs to some families. He gave the knowledge he attained and he wrote the Ashtanga Hridaya, and that is a great wealth nowadays also. We have to read so many manuscript papers. The issue is that everything should be based on evidence. An evidence-based approach that should be increased in indigenous medicines or indigenous medicine department. Ayurveda also, it is like that. We have so many medicinal plants and plants here, but we should have to take, we should have to make it evidence-based. We should have higher researchers on that, and we should have to get patent on some medicinal plants, etc. I want to point out one thing that throughout the world, the research is going on. And in India also, we are trying to do that. Our neem and our turmeric, etc. are good medicinal plants and herbs. But we have to propose or promote the research more, this kind of medicinal things. And Government of India is now supporting Ayush sector more. Kerala is also is walking more distance, or we want to walk more distance on this part. And Kerala started something in Kerala that we want to integrate the modern medicine and the indigenous medicine together. And in primary level itself, we started that work. In primary level, we are converting our primary health centers to family health centers to get individual attention to each and every persons in the society. On that part, we are implementing Ayurveda also. Because Ayurveda believes, or Ayurveda stands for the charyas, Ruducharya, Dinacharya, etc. That means the lifestyles. Today in Kerala, we are facing the lifestyle diseases, lack of physical exercises, and the new eating habit that is not good for health. We have to change that thing. Then only we can reduce cancer, reduce diabetes, and reduce hypertension, etc. And health, not only for the body, but also for the mind, it is so much important. And we are promoting now yoga practice to promote the mental health and promote the lifestyles. We are also implementing that thing also. In each and every primary health centers, not only Ayurveda primary health centers, but also modern medicine health centers, we are starting some small mini gymnasiums, or we are starting yoga centers in primary health center itself to promote the physical exercise in human beings, in the citizens. That way we can improve the lifestyles and we can reduce the lifestyle diseases. And we are integrating all these things, the Ayurveda, Siddha, Yoga, Naturopathy, and modern medicine. Wherever we can integrate these things, we are integrating. During the COVID seasons, we have a very good result out of this. And we planned and we introduced some new projects for new programs for containing the COVID-19. Especially in Ayurveda, we started Swasthya project and Punarjani, several projects like that. And we started to make the improvement or improve the resistance, body resistance against this infectious disease, and the prevention is better than cure. That way, we started Ayurveda medicine throughout the society to get good immunity to prevent the infectious disease. We produced more medicine in our medicine production center, Aushadhi, and we distributed that medicine throughout the society. And we are also studying the after effect of that. And very good research and very good documentation is going on. I think in future that study will help us more. And also the post-COVID effects, we started Punarjani clinics that after COVID, there are so many post-COVID effects. COVID is affecting the heart, affecting the lungs, and people are suffering from post-COVID issues. For that also, Ayurveda is a very good medium, and we started Punarjani clinics. People are coming to this clinic and we are examining thoroughly, and that also we are documenting. Our documentation will help in future that how can we reduce the infections in the lungs, and also okay. We are finding out what will be the after effect of this experiment in Ayurveda. I think definitely it will give some good result on it. I am not explaining everything, but we have to improve Ayurveda in all sector. Not only the treatment, but also several research should take place. We have already started an Ayurveda research center under our health university in Ernakulam. And we also started, it is building, work is going on for an Ayurveda research center and also a museum and also a manuscript reading center. We acquired 300 acres of lands for it, and our aim and intention, our project is to start a 100-bedded hospital for, especially for research. The project is started its construction is started there. and also a very good medicinal cultivation in the premises. And we are starting the manuscript reading centers, etc., to make all the knowledge evidence based. We are acquiring knowledge from the old and the traditional papers also. That should be the future, and we have to do that for the future. I'm not explaining all these activities, but the Ayurveda sector, we can improve in the business sector also. There is a chance for the Ayurveda. Throughout the world, Sri Lanka is utilizing their Ayurveda sector well, I think so. And in Kerala, we are also thinking to promote the wellness treatment. People are looking to Kerala to get more wellness centers here. Not only Kerala, but throughout India, there is a chance to improve the business sector also. That way, we can solve the problem of unemployment also in that sector, and also the health issues. We can also solve the health issues also, and we can try together. And after this seminar, I think we will get valuable points, and we can utilize together. The whole world is together in search of solutions for infectious disease and also solutions for lifestyle diseases. And we can work together. Kerala will be with all of you. And with these few words, with the new hopes, I conclude and I declare the webinar open.
Thank you, ma'am, for inaugurating this webinar, Swasthya 2021. Your words have indeed motivated the Ayush team to contribute further in the identified strong areas of Ayush. Now, we welcome Padma Shri Dr. Vaidya Radesh Koteja ji, Secretary, Ministry of Ayush, Government of India, to present the keynote address. Vaidya Koteja ji is a former Vice Chancellor of Gujarat Ayurveda University, Jamnagar, and author of 2 books, The Concept of Atattva in Ayurveda, which discusses minor psychiatric disorders in Ayurveda, and A Beginner's Guide to Ayurveda for elaborating principles of day-to-day life practices to keep oneself healthy. He received the Global Ayurveda Physician Award in 2007, Ayurveda Ratna Award in 2008, and the Padma Shri in 2015. We welcome you, sir, for delivering the keynote address on Ayurveda in diverse domains of public health, perspectives, and prospects. Welcome you, sir.
Thank you. Honorable Minister Srimati Sairaja Teacherji, the Secretary, Principal Secretary, Department of Health and Family Welfare, Dr. Rajan Kobragadeji, the Ayush Secretary in Kerala, Dr. Sarmila Mary Joseph, IAS, the Mission Director, Dr. Divya Iyer, all the team of Ayush in Kerala, and all the participants, experts, my colleague, Sri Pramod Pathak, Additional Secretary, Minister of Ayush. This is indeed a great opportunity and honor for me to be here for this keynote address into this prestigious and important webinar, where we are discussing about Swasthyam, and we are also discussing about how we achieve SDG 3 through interventions of Ayush. So, and I'm very happy that the topic of my keynote is very apt, is about perspective actually. So Ayurveda in diverse domain of public health, and we are supposed to discuss about perspectives and prospects. So when we look at these potentials of Ayush, particularly Ayurveda, is huge. And usually when we talk about Ayurveda, we have some great idea about Ayurveda or some great misconception about Ayurveda. So I would like to mention first of all which domain Ayurveda can cover, and then I will discuss something about perspectives and then potentials, prospects. So it is I would like to connect. It is believed that Ayurveda means wellness. It is like wellness tourism. It is something for preventive and promotive. I would like to mention that no, it is not true. Ayurveda is a holistic science is a science of life. If you look at the word of Ayurveda, Ayusho Veda iti Ayurveda, means that which talks about life, which is everything in life related to health is Ayurveda. So Ayurveda is science of life and not just medicine, not just treatment of diseases, but it is everything. So promotion of health, prevention of health, wellness, and curative aspect of disease management. Everything is included in Ayurveda. This is one thing. The another thing is that whenever we talk about Ayurveda, sometimes we miss that Ayurveda is a science of herbology or herbal medicine. It is also do not reflect the entire Ayurveda, because Ayurveda talks about an individual's prakruti, dosha, and then desha kala, means, and it talks about entire perspective of an individual's being, including mind. So the herbal medicine or medicine part of Ayurveda is also a component, but in addition to that, there are a lot of therapeutic interventions, lot of preventive interventions, lot of recommendations and wisdom about nutrition and so on. So this is another thing that I wanted to mention. One more thing that sometimes when we discuss about Ayurveda, we also, we mentioned that Ayurveda means non-communicable diseases. It's good for chronic diseases, but it do not have anything to offer for infective disorders or acute crisis in health. It is also not true, because Honorable Minister just mentioned, Srimati Shailajaji, she has mentioned about the tremendous and impact and contribution of Ayurveda in Kerala, and the distribution of medicine and different programs implemented from the Ayush department, Kerala, for the mitigation of COVID-19. So if I mention something really good to know, that Government of India, with the help of a lot of state governments, including Kerala government, and lot of universities, the national institutes of associated with Ministry of Ayush and research councils, we were able to initiate more than 112 studies across the country for during this COVID crisis. These studies were all scientifically very robust, uh, designed and then vetted by reviewers from all across the scientific community, including ICMR and other experts. And these studies had different designs. So randomized control trials were there. Randomized control trials were also in two ways, either as an add-on therapy to conventional care or standalone Ayush intervention, or prophylaxis, or observation studies, or preclinical studies in, with the help of Department of Biotechnology. We had a lot of preclinical studies to understand the mechanics of these interventions. Uh, we also had a very good impact assessment study that I would like to discuss little later. Total, there were approximately 140 sites across the country, and more than 500,000 subjects, participants were registered for this study. As of now, 65 studies are completed, and 30, 34 manuscripts for the publication has been finalized. Out of these, 16 manuscripts are submitted for the publication to the different journals. Uh, 14 manuscripts are under the review. 14 manuscripts are submitted for the preprints. Preprints are available of at least six preprints are available. There are 2 publications in Trials Journal, which is very high impact journal. But all this are going on. In next few months, you will see at least more than 30 publication into very good journals. What I'm trying to convey is that this COVID crisis has come as an like for Ayush, it is like an equal footing exercise to provide some relief, to provide some solution for the crisis in pandemic. So for infectious disease also, Ayush intervention has proved its worth by generating a lot of evidences and by helping the community into this crisis. This could be a very good model of how India has tackled this crisis. And we have collaborated with WHO. WHO has sponsored a study, supported a study, which is about to start, is to look at how Ayush intervention, integration of Ayush in public health has worked and helped India to fight against COVID-19. So it is about, this study is about to start. WHO has already sponsored this study and PHFI is doing this study. So infection control, pandemic control, non-communicable diseases, chronic disease, and acute crisis. Everywhere there is some solution of Ayurveda is there. So these are the different perspectives. There is one more perspective that I would like to discuss about, that Honorable Minister was mentioning, that we have to generate evidences. There is no doubt about that. We need to generate evidences. We need to talk to the scientific community in the manner, in the language, what they understand. So there is no doubt about that. We all have to work hard, and cumulatively, collectively, we should go to that direction. And Ayush Ministry is working into this direction. There are some interesting facts that I want to mention. That it is a lot of health research. We have Dr. Khobragade is here. Dr. Samilaji is also allopathic doctor. So we all know that the conventional health system research is mainly done by basic science people. Health research is not being done by allopathic doctors. Most of this health research, except clinical research observation and which is happening into the hospitals, they are there as a technical expert, but research work mainly is done by health research experts of different domain. When it comes to Ayush research, it is by default believed that it is the task of Ayush people. Ayush people should do Ayush research. So the perspective of this, we should all have, should think into this direction. And research is into area of Ayush. It should be a collective responsibility of all scientific organizations. And then we can take Ayurveda to its original glory, because the Ayurvedic practitioners are not all of them are not scientists. They have, if they have training of science, they are more experts of clinical research. They are not experts of basic science research, preclinical researches. So Ayush Ministry has developed some benchmark. For example, we have given a center of excellence to IGIB, Institute of Genomics and Integrative Biology, which is a CSR institution for, they are known worldwide for their high-end research on human genome. So they are working in the area of a relationship of Prakriti with the human genome, and they found some wonderful observations. They found that a person with Vata Prakriti trait have a specific genetic pattern. A person with Pitta Prakriti trait has a specific genetic pattern, and same as Kapha Prakriti pattern. And they found something more, that the Ayurvedic understanding of dosha and Prakriti may be related with the microbiome and further to phenotypes. So those types of studies are required. And I'm happy to inform the august audience that with the help of our research councils, with the help of the team of IGIB, from this year, Jawaharlal Nehru University have started a 5-year integrated course on Ayurveda biology. The idea is to generate a human resource who knows Ayurveda and who understands basic science, so that a pool of researchers can be, human resource for researchers can be generated. So this is a very good effort and an example how we can proceed. The another thing is that when we talk about Ayurveda, and we go to any public platform, it is always mentioned that Ayurveda people should generate evidences. So I would like to mention that Government of India has launched a portal. Name of this portal is Ayush Research Portal. On this portal, there are more than 30,000 publications are posted. Their abstracts are available, and all these publications are only selected from index journals and PubMed reviewed journals. So it's not taken from predatory journals. And it is interesting that out of these 30,000, around 300 plus publications are based on randomized control gold standard trials. So this sector is also doing a lot of research. The only problem is that their publications are not appearing in high-end journals like Lancet and Nature. But we all know that to crack that, we have to also crack this prejudice mindset of those people, because they are so prejudiced. So we are experiencing this prejudice. So we are constantly, communicating with them in review process. So we understand that the same yardstick is not applicable, not applied when the something with natural medicine comes up for this such high publications. So we have to correct this. We have to look at that possibility. It is only possible when Ayush research is considered as onboarded for every scientific organizations. Everybody should own research in Ayush, and then it can definitely grow into the very, very high level of productivity and outcome. Some examples in public health. Honorable Minister also has mentioned that there is a great scope of integration of Ayush into public health. So I would like to cite some simple example, and I make sure that I will not exceed my time. We have Dr. Narhari in Kasargod. Dr. Narhari has an integrative hospital approved by Government of Kerala, and they are working in the area of lymphadenitis, and we all know that lymphadenitis, which is also known as elephantiasis. And in lymphadenitis, once a person gets lymphadenitis, and then morbidity management is a big problem. So his institute has actually established wonderful protocol, integrative protocol based on Ayurveda, yoga, and allopathic system of medicine, where he offers solutions for morbidity management, where this solution actually reduces the lymphadenitis, to the great extent, and improve the quality of life of the persons affected with lymphadenitis. So we are working with them. We are trying to get these solutions into mainstream public health, because for morbidity management, lymphadenitis, there is no solution. So if such kind of solution is possible, why not we can bring it in into mainstream. So why I mentioned this, because this institute is already in Kerala. So I would request Honorable Minister to look at this possibility, and maybe we can collaborate further into this area. The another example is that Government of India has recently concluded, it is already ongoing, there is a pilot study going on for non-communicable diseases on large scale interventions, where the allopathic doctors and Ayurvedic physicians and yoga therapists, yoga practitioners are working together in 6 districts of our country, and they are working together to offer solutions, non-intervention, non-complicated solutions for diabetes, hypertension, and dyslipidemia. And the results are outstanding. Results are, it says that by simple intervention, the people have, a significant reduction to then HbA1c, their better blood glucose control, their quality of life has improved. And in lot of the cases, the allopathic doctors have either reduced the medicine or stopped the medicine. So it's true for the diabetes, it's true for the hypertension, or it is true for the dyslipidemia. So this experiment on large scale sample sizes, more than 500,000 sample size, is very big. And now we are working with Ministry of Health and Family Welfare, and to get this into nationwide implementation in public health in integration model. So this is also happening. We had a public health intervention project in one of this area block of Karnataka in Belgavi, and what we have seen in several schools, that before intervention of this particular project, we did a screening of those school children, and we found that more than 26% of children were anemic. And after 6 months of intervention of Drakshavale is very simple medicine, very well-known medicine in Kerala also, and Ayurvedic physicians are using it a lot. So intervention of Drakshavale over 6 months has been able to reduce this intervention from 26+% to merely 1%. So those kind of experiments are there. Now we are working with Ministry of WCD and into the Poshan Abhiyan. We are trying to get this implemented in the large scale under the catchment area of Ayush Health and Wellness Centers, where Anganwadi centers are there. So what I'm trying to convey that our anemia control program is going on since so many years, and we have this standard management by giving iron, folic acid to the mother or lactating mothers or children. But our markers of anemia has never improved. It is staying at the same. So why not we think about these types of integrative model. That is what I am trying to convey as a prospect. There is another experiment we are doing in Gadchiroli district of Maharashtra as a district-wise implementation of maternal health and intervention of Garbhini Paricharya. That is also one of the good examples to take it to the further level. Adjuvants of Ayurveda in TB and adjuvants of Ayurveda into cancer management is another area where we can work together and contribute a lot. At the end, I want to compliment the leadership of Honorable Minister Srimati Shailajaji. I met her several times, and I'm quite impressed with her, simplicity, her accessibility. She's always available. Few times I need to call her, and then to my surprise, she would be immediately available on the call, on the phone, and she's always proactive. So it is her, under her leadership, Ayush has grown so much in Kerala, and then lot of innovative programs that was mentioned by Dr. Khobragade and Dr. Samila Joseph Mary. These are implemented particularly during COVID also. And then one of the USP is that all of these activities are properly documented. So once if things are documented, then it is having a scientific value. So I compliment Honorable Minister Ji and the Principal Secretary Health and Principal Secretary Ayush for all these wonderful effort about Ayurveda and Yoga intervention into the state of Kerala. Kerala has a great potential. Honorable Minister has mentioned about commerce also. So I would like to mention that for post-COVID management, lot of people want to come to Kerala, particularly for the Panchakarma. And we have received representations from Dr. Ramanathan and other Kerala-based organizations, and we have specifically written to Ministry of Home Affairs, and I'm personally following it up, that the visa facilitation for people want to come for Ayurveda post-COVID Panchkarma programs, they can be facilitated to come to Kerala. So it will help us for the converting this into an opportunity and serve the global community with the humble Ayurveda and Yoga intervention. There's another fact is that due to COVID in last 1 year, less than 1 year, this sector, manufacturing sector, has grown by 44 to 90% in different product segment, and it is a huge growth. And we need to make sure that this growth is continued and it can be capitalized at a global level. So my request to the Kerala people from Kerala into the sector to help and to take this opportunity. We are there to help and coordinate with all available opportunities. There are 2-3 things. One is championship services, and their championship services provide a lot of assistance to the investors and entrepreneurs to set up their own centers, daycare centers or hospitals, or if there is a requirement of global commerce, then we have Invest India on board, and we are ready to facilitate and help the quality export of Ayush into the different parts of the world. I thank again for this opportunity provided to me and to participate in this unique event. My namaskaram to all. Pranams.
Thank you, sir, for giving your valuable insights. For your information, sir, the schemes being implemented by Kerala under the aegis of the National Ayush Mission uphold the best traditions and legacy of Ayurveda. Let me now invite State Mission Director, National Ayush Mission, Government of Kerala, Dr. Divya S. Iyer, to deliver word of thanks. Welcome, ma'am.
Thank you. It's said that joy is the simplest form of gratitude. I stand here with a great deal of joy in being able to thank each and every one of you, the stalwarts who have given form and breathed life into Swasthya Webinar 2021. First of all, I thank our Honorable Minister, Srimati K.K. Shailaja teacher, for being the guiding light and a force to reckon with
to all of us in the state of Kerala, especially in healthcare sector. It also helps that she is the face of women empowerment, not just in Kerala, but across the globe, because she definitely exhorts and inspires every woman to be the torchbearer of good health into their families as we foster family health centers across the state of Kerala and bring in health and wellness centers across the state. Thank you so much, ma'am, for embracing every school of healthcare in Kerala with equal enthusiasm and gracing this occasion with your august presence and delivering a very inspiring inaugural address to us. Thank you. Our respected Secretary, Government of India, Padma Shri Vaidya Shriman Rajesh Koteja-ji, we have just lent our ears to his words of wisdom, wherein he has taken us through the way forward and emphasized on the importance of conducting good research in our field as well. Thank you so much, sir, for being with us today evening. We place and record from Team Kerala our deepest gratitude for your continuing guidance and support to our state. I thank Dr. Rajan Khobragade for always being there for us. His unassuming nature and unfailing support, combined with his able leadership and his noble vision for healthcare in Kerala, has been a pillar of strength, especially during the troubled times of health that we have faced in the state and across the country. It's truly a privilege and a good fortune for us to be led by somebody like him. I thank you from the bottom of our hearts, sir, for being here at Swasthya 2021. I thank Dr. Sharmila Mary Joseph with a lot of love from all of us here, because she has been a constant presence in our lives, especially in the last few days, I have to admit, for she has been relentlessly pursuing every single aspect of Swasthya 2021. And I'm certain that everybody would agree when I say that this has been her brainchild and born child. So all credit to Dr. Sharmila Mary Joseph for this event today. And we are eternally beholden to you for being such a charming presence in our lives, and also for giving us the courage and the encouragement to take Ayush to greater heights in the state of Kerala. I thank Additional Secretary, Ministry of Ayush, Shri P.K. Pathak, and all the other dignitaries who are about to enlighten us with their words of wisdom in the scientific sessions and the panel discussions to come in a few minutes. I would be remiss if I do not mention the valuable contribution put in by the technical committee headed by Dr. Rajmohan and his team at Government Ayurveda College Trivandrum here, and my team at NAM, and the IT team who has lent us all support for making this event a big success. Thank you so much, each and every one, and a special thank you to our compeers today, Dr. Anantalakshmi, Dr. Lakshmi, and Dr. Ranju, and everybody who has chipped in their bit into making Swasthya 2021 a meaningful effort. A big thank you to all the participants out there, for without you, this would be of no value. Thank you so much.
Thank you, ma'am, for your nice words. And with this, we come to the end of inaugural session. Thank you all.
The inaugural session has set the tone for the discussion of the day. As mentioned earlier, the scientific sessions will focus on the role of Ayurveda in 4 thematic areas: health and wellness, non-communicable diseases, geriatric care, and pain and palliative care management. Kerala Ayush is fortunate to have medical doctors at the helm of affairs of Ayush Department too. Principal Secretary, and SMD are doctors by academic training. Their insights and leadership and holistic outlook have definitely contributed to the development of the Ayush sector in Kerala. The first session will be presented by Dr. Sharmila Mary Joseph, IAS Secretary, Department of Ayush, on the topic Ayurveda in the diverse domain of the Kerala Public Health. Dr. Sharmila Mary Joseph is an officer of IAS of 1997 batch Kerala cadre. She is a medical doctor by academic training and has done Masters in Public Administration from Maxwell School of Policy and Public Affairs of Syracuse University, USA. Prior to her present stint, she had worked as... Okay. So I invite Madam for the presentation. Welcome, Madam.
Thank you. We begin the scientific sessions of the day. The topic that has been assigned to me is Ayurveda in the diverse domains of Kerala public health. In the inaugural session, we heard from the eminent speakers, from the Minister, Secretary Government of India and others as to the immense and vast potential that Ayush sector, particularly Ayurveda, holds out in the various domains of public health. Health, as I mentioned earlier in my speech also, is not just the absence of disease. Health encompasses complete physical, mental, and social well-being. So it is this that guides Ayurveda, how Ayurveda approaches a human being with a complete personalized approach, a holistic approach that does not look at a patient by his disease or by his symptoms, but looks at the patient as a human being and then decides on the course of treatment and the management protocol for that particular patient. Kerala, as we mentioned earlier, stands tall among the states of India because of the very good indicators, the very good results that Kerala has shown in various health and social indicators. Kerala has the best Human Development Index in India. The HDI 2018 shows that her HDI is 0.779, whereas which is almost comparable with that of many developed countries of the West. Kerala is the state with the highest female literacy in India. The National Family Health Survey 5 results show that our literacy rate is 98.3%. We have the highest female sex ratio in India. The MFHS 5 shows that our female sex ratio, is 1,121. The people of the state have the highest life expectancy at birth. Kerala has the best figure as far as the SDG 3 achievements are concerned. SDG 3 deals with health, and this whole webinar series is on how we make SDG 3 a reality in the state. We have the lowest infant mortality rate in the country. The HMIS data of December 2020 shows that our IMR is only 5 per 1,000 live births. Our maternal mortality rate is only 29 per 100,000 live births. This is also as per the HMIS data of December 2020. So this is where we stand with our very good health indicators, our good health infrastructure, an active medical fraternity in the modern medicine side as well as the Ayush side. Now coming to the focus areas of today's webinar series, today's webinar on Swasthya, the first focus area is the role of Ayurveda in health and wellness. We discussed that earlier, what is health, what is wellness, and how Ayurveda, through its holistic approach, its positive biology approach, its personalized approach, looks at individuals as full individuals and not just as somebody with a particular symptom or somebody with a particular disease. Ayurveda science, as I understand, treats a person from this with this holistic angle, and therefore prescribes a particular management protocol which ensures that the health or the wellness of the patient is ensured. So this approach is also based on the seasonalized and the daily regimen approach, which we discuss under Dinacharya and Ritucharya. Because as the Honorable Minister also mentioned, in the treatises that we have, the textbooks, the ancient textbooks of Ayurveda, the details of how a person should adjust his daily lifestyle, how a person should adjust his daily routines according to the requirements of his body and mind, that is all well prescribed in the textbooks of Ayurveda. Similarly, how one should adjust to the situation depending on the season. Ayurveda prescribes specific diets and lifestyles and ways of living in the different seasons. So these perhaps are the contributing factors, the fact that the people of the state had been abiding by these principles of Dinacharya and Ritucharya are perhaps the reasons why the health indicators of our state, why the state could achieve such good results as far as various health indicators are concerned. So when we look at how we have institutionalized health and wellness through our medical sector as well as the other sectors of the state, we find that not just the Department of Ayush, but the Department of Tourism and the other agencies attached to the Department of Tourism, our hotels, our resorts, also provide the best kind of health and wellness treatment to people coming to these centers from across the globe. People come to our state, as I mentioned in my welcome address. People come to the state from all over the world for the specialized health and wellness packages that our trained people provide through these resorts, that trained therapists, trained physicians provide to those who visit those centers. And the treatment, the packages that are provided are based on the Ayurvedic science, and the medicines are prepared from specialized items and specialized products from the natural herbs and medicinal plants that grow in our state. So for the health and wellness packages as such, we have specialized Panchakarma packages, specialized Rasayana packages, and other packages which ensure that the general health and immunity of the people is enhanced. So this is perhaps one reason how Kerala became the tourism hub of the country, and perhaps for tourists from across the globe also, how we provided proper health and wellness care through our Ayurvedic centers and through our resorts and such institutions. We also have institutionalized the health and wellness concept at the community level through our Ayush Gramams and through other schemes that we are implementing through the Department of Ayush, through the Department of Ayurveda and the institutions under the National Ayush Mission. So at the moment we have some around 16 Ayush Gramams functioning across the state in all districts, and these Ayush Grams work to ensure that the people are made more aware about their dietary habits and lifestyles, which are described in the Ayush systems of medicine. And this also encourages the local community to do more for preserving and cultivating the medicinal plants and herbs which are found in our surroundings, and also to promote home remedies for common ailments. Now, the next theme for today's scientific topic or scientific discussion is Ayurveda in lifestyle disorders. Honorable Minister in her inaugural address had mentioned how the challenges, the second generation challenges that Kerala health faces today. Kerala is faced with the situation where vast majority of our population is prone to lifestyle diseases like diabetes and hypertension. The NSHS 5 data shows that there is a very high prevalence of diabetes mellitus in our population. Women more than 15 years, 24.8% of women more than 15 years have either high blood sugar or very high blood sugar and are receiving anti-diabetic treatment. Men, 27% receiving treatment for diabetes mellitus. When it comes to hypertension also, 30.9% of women more than 15 years taking medicines for hypertension, 32.8% of men more than 15 years taking medicines for hypertension. Then anemia in the 15 to 49 year age group, 36.3% of all women in the 15 to 49 year age group are anemic. So have we done something through our Ayush sector to keep these lifestyle disorders at bay? Yes, we have some projects which are being implemented through the Department of ISM. One such example is the project Jeevani, which is a project for Ayurvedic management of diabetes mellitus. So as the previous speakers mentioned, what we have to do in the coming days is to ensure that whatever is done in the Ayush sector is properly entered, the data is properly analyzed, the data is entered systematically and scientifically evaluated to sort of ascertain that the treatment regimen, that the modalities that are prescribed through Ayurveda are really useful. So in the project Jeevani, and rushing through because of paucity of time, in the project Jeevani, which is being implemented through the ISM department, the Ayurveda department, in the studies that was done, say, in around 400 to 600 patients over the last 2 years, there was a statistically significant reduction in the fasting blood sugar, postprandial blood sugar, and HbA1c after treatment over a 6-month period. And subjectively also the patients reported, considerable relief as far as various complications were concerned. So this is the data that we could pick up from what is there in the departmental records. But I should admit that, our department has to do little more to ensure that the data is, entered little more systematically so that we have strong evidence-based data to actually support the findings that we see in the field. Then this is another example of a project which was being implemented through the Department of Ayurveda for managing anemia in school-going children. So here also through the Ayurvedic management, what we found that in a study in the data that we had collected over the last 2 years, there is a statistically significant improvement in the hemoglobin level of these children who were given the Ayurvedic management. And also subjectively, the children reported, positive, good relief from various symptoms, as we can see in the slide. Then Ayurveda in pain and palliative care is the next theme for today's discussions. So here also I'm citing the example of a scheme called Punarnava, wherein Ayurvedic management was done, Ayurvedic treatment was given to patients who had recovered from stroke, from cerebrovascular accidents. So here also, based on the data that is available, there is substantial improvement in the post-stroke functional capabilities of the patient. And it's also reported that in the muscle wasting had come down, people with spasticity got relief, appetite and bowel habits improved, speech improved, movements improved. So here again, what we need to do further is to sort of enhance the scope of such projects and ensure scientific data collection, scientific data analysis, and scientific evaluation of the data. So this is the these are the figures based on the data that we have in the Department of ISM. So in this context, I would also like to mention that another project is being implemented in the Government Ayurveda College Trivandrum in collaboration with Sri Chitra Institute of Medical Sciences, where again specialized Ayurvedic therapy is being given to patients who are recovering from cerebrovascular accidents. Then Ayurveda in geriatric care, that is the next topic for discussion. So this also has immense potential, has vast scope. We have a project called Susmritam, which is being implemented through the Ayurvedic department. And here also, through the specialized Ayurvedic care that was given through the scheme, statistically significant results were recorded in the data that we had analyzed so far. This is also the pie diagram showing the relative figures. Then we also spoke about, the role of Ayurveda in enhancing the immunity of the population so as to improve their resistance, increase their resistance, so that they don't easily fall prey to diseases like, COVID and other new and emerging infectious diseases. So the state government implemented a project Amritam, under which there were sub-schemes where prophylactically, preventive medicines were given to a large number of people. People who were in quarantine were also extended the support. Then people who had recovered from COVID in the post-COVID period were given Ayurvedic support. And also 3-4 months back, we had also started extending Ayurvedic management to patients with mild COVID and who did not have any other comorbidities. So as per the data that we have compiled, close to 5 lakh people received Ayurvedic support under the aegis of Amritam. And the detailed report is under, detailed evaluation and scrutiny. So this is what I had to, mention as part of the initial presentation. The different speakers in the who would be following me would be speaking on each aspect and would be throwing light on the specific potential of Ayurveda in the individual area. I would also like to mention that, as part of health and wellness, we also have Sports Ayurveda. We have an institute called Kerala Institute of Sports Ayurveda and Research at Thrissur, where specialized Ayurvedic support is given to sportsmen and sportswomen to improve their strength and overall resilience and to ensure that, they maintain proper health and wellness. So I would end there because I do not want to, extend eat into other people's time. So thank you for your patience. Thank you for your patient hearing. Thank you.
Thank you so much, ma'am, for your insightful talk. Your talk has set the ground for future growth and development of Ayush sector in Kerala. Now, let's move on to the next topic, perspective of Ayurveda in health and illness and its social and financial prospects. And we have Sri P.K. Pathak, Additional Secretary in Ministry of Ayush, Government of India, to present the topic. Sir has extensive experience in various departments of Government of Kerala and in ministries of Government of India prior to the present posting. I now invite Sri Pathak to present the topic.
Honorable Minister for Health, Family Welfare and Social Justice, Srimati K.K. Sharja Teacher, Padma Shri Vaidya Rajesh Kotecha Ji, Secretary, Ministry of Ayush, Dr. Rajan Khobargade, Principal Secretary, Department of Health and Family Welfare, Dr. Sharmila Mary Joseph, Secretary Ayush, Government of Kerala, distinguished participants and panelists. It is my proud privilege to be a part of first 2021 sessions of webinar series organized by Government of Kerala to acknowledge the contributions of traditional medicine, particularly Ayurveda, in the Kerala health success script. In fact, Kerala is known for very innovative works in the Ayurveda sector. In fact, this was the first, I belong to the Kerala cadre, so I have been observing the developments in Kerala since 1988 onwards. So this is the first state, I think, that has worked so extensively in the field of traditional medicine, especially in the field of Ayurveda. So as it was mentioned in the previous lecture, that Ayurveda advocates a lifestyle which provides a healthy body, mind, and overall happiness by working on the principle of restoring natural balance and bringing human life back in harmony with nature. Ministry of Ayush is working primarily to propagate this type of lifestyle. It is providing focused attention for the development and promotion of Ayush system, including Ayurveda throughout the country. I would like to mention that Ayush is an acronym for Ayurveda, Yoga and Naturopathy, Unani. Soa Rigpa is a new addition which is prevalent in the Himalayan belt, and we are having a National Institute of Soa Rigpa, a newly created National Institute of Soa Rigpa in Union Territory of Ladakh. It is located in Leh. Then Siddha system is also there, and then homeopathy system. So all traditional system of medicine, 7 traditional system of medicine is being monitored by Ministry of Ayush. Ministry of Ayush is implementing the centrally sponsored scheme of National Ayush Mission through state union territories and providing financial assistance to them as per the proposals submitted through their respective state annual action plans. National Ayush Mission comprises of 4 core components: Ayush services, Ayush education institutions, quality control of ASU and H drugs and medicinal plants. In addition to the core activities, provisions are also made under National Ayush Mission for flexible component and administrative cost. Under Ayush services components of National Ayush Mission, support is being provided to the state union territories for different activities like co-location of Ayush facilities in primary health centers, community health centers, and district hospitals. Supply of essential drugs to Ayush hospitals and dispensaries, upgradation of standalone Ayush hospitals and dispensaries, setting up of up to 50 bedded integrated Ayush hospitals, public health outreach activities, Ayush Gram, which was mentioned by my predecessor, school health programs, etc. Kerala is very actively implementing the National Ayush Mission, and since 2014-15 onwards, when the National Ayush Mission was promulgated, around 100 crores has been provided to the state government, and it has done excellent work in the implementation of National Ayush Mission. Some of the works I would like to enlist here. Under National Ayush Mission, Ministry of Ayush has approved 2 up to 50 bedded integrated Ayush hospital at Chalakudi, Thrissur district, and Matanur, Kannur district. Under flexible component of NAM, Ministry has provided financial assistance for some of the important activities, projects such as NCD prevention and management, naturopathy hospitals at Varkala, Ayurkam, Drishti, strengthening of women and child hospital at Pujapura, Ayush tribal mobile medical unit, Ayurveda anorectal clinic, Arogya Swandanam, Srehadara, infertility centers, Ayush holistic center, etc. Further, the Research Council functioning under the Ministry of Ayush are conducting several research studies in various disease conditions. The research councils are involved in various activities related to development of Ayush systems in terms of scientific research, training, and propagation. In fact, Secretary Ayush has mentioned some of the activities regarding scientific validation of Ayush system, and Honorable Minister has also mentioned that how we should propagate scientifically the various aspects of Ayush sector in order to talk to scientific community in the same language, because Ayush has a lot of potential and it can cross the frontiers also. We are approaching various global partners for conducting collaborative research. So this type of scientific studies as propagated, as described by Honorable Minister, will be very, very useful if you want to take it forward, the various system of traditional medicine. I would also like to highlight some of the important steps taken by Ministry of Ayush, Government of India to combat the COVID-19 pandemic. In fact, since February onwards, Ministry of Ayush is continuously engaged in combating and management of COVID-19. Ministry of Ayush issued an advisory on 29 January 2020 on how to protect oneself from COVID and how to stay healthy by improving the immunity. Secretary Ayush was the member of group of secretaries which was constituted for the capacity building for the management of COVID. And immediately after becoming a member, Ministry of Ayush offered all its hospitals and its trained manpower, Ayush doctors, Ayush allied some say healthcare professionals, as well as nursing staff. Our entire thing was put at the disposal of the respective state governments and government of India, so that the entire thing be converted into COVID hospitals. Around 8 lakhs, 8.5 lakhs Ayush professionals, which includes Ayush students, Ayush doctors, Ayush paramedic staff, and Ayush anybody who's Ayush in the colleges who are working around. It was provided, and the list was provided on covidwarrior.gov.in, so that district administration can take help of this personnel for clinical management as well as management of isolation centers and quarantine centers. They were trained, and training modules were developed by igot.gov.in platform of DOPT, so that they can see these online tutorials and train themselves for the management of COVID. Ministry has also shared the advisory with states, Union Territory government on 6th March 2020. And again, another advisory was issued in 29th March 2020, which was translated into 8 foreign languages: Spanish, Russian, German, and it was propagated all over the world through our Indian embassies, so that people can understand immediately, take recourse to the whatever the advisory was propagated by Ministry of Ayush. Because at that time there was no cure, people were clueless how to manage. So the only thing was that improve your host defense mechanism in such a manner that any attack on the host defense mechanism can be countered with your improved immunity. So a lot of advisories were issued within considering the importance of immunity boosting measures in the wake of COVID-19 outbreak. Ministry of Ayush has promoted use of ready-made Ayush formulation, Ayush Quath, in the interest of health promotion to the masses. So various advisory were issued to promote the large-scale production of Ayush Kadha, and then Ayush advisory, Ayush medicines, and enabling provisions were made in the Drug and Cosmetics Act under the power vested with the Ministry of Ayush, so that more and more medicines should reach the maximum masses. Production was enough because those were difficult times, and most of the production units were not in a position to supply to meet the demands. So our own IMPCL, public sector undertaking, they went on overproduction and ensured the supply of Ayush medicines and Ayush Kadhas, immunity boosting kits to the various people in the country. In fact, we did a very good study with the Delhi police. Around 1 lakh Delhi police personnel were provided Ayu Raksha kit containing Adu Tel, Chyawanprash, Shamshwani Bhatti, and they used it and found that the incidence of COVID has come down drastically in the frontline staff. So we conducted research studies also, and as I mentioned my Secretary Ayush, we are going to publish a paper in the high impact factor journal also. So another study initiative was taken in the public health management was the Ayush Sanjeevani mobile app. It was developed by Ministry of Ayush, and it has documented the impact assessment of effectiveness, acceptance, and uses of Ayush advisories and measures in the prevention of COVID-19 through mobile app-based population study in around 1.5 crore respondents. In all, 1.5 crore people participated through mobile app to ascertain whether how much they are taking recourse to the Ayush advisory in Ayush medicine. And it was observed that 85% of the respondents reported use of Ayush measures for prevention of COVID-19, among which 89.8% respondents agreed to have benefited from the practice of Ayush advisory. 79% of the users responded that the Ayush measures gave an overall feeling of wellness. 63% reported improvement in parameters of well-being like sleep, appetite, bowel habits, stamina, and mental well-being. So over a period of time during a very COVID time, a lot of initiatives were taken, and it was various awareness camps through social media also, because physical meeting was very, very difficult. Through social media also a lot of advisory was issued, because at that time mental wellness was also, because normally through medicine physical wellness was somehow was controlled, but mental wellness was a big challenge. Regarding that, some yoga asanas were promoted, and through our social media, through Twitter handles, a lot of advisory was issued, which was adopted by people in large in our country as well as foreign countries also. Guidelines for registered practitioners of respective system of Ayush, including Ayurveda, have been prepared by research councils and national institute with their team of experts, and the same is vetted by the interdisciplinary Ayush Research and Development Task Force of Ministry of Ayush. These vetted guidelines are made available in public domain for the benefit of registered Ayush practitioners to help in the management COVID-19 pandemic uniformly. Here I would like to mention that in order to propagate scientific research and various scientific activity, Ministry constituted interdisciplinary Ayush Research and Development Task Force from the scientists from ICMR, from various CSIR, DBT, from our research councils, and then it was chaired by the Vice Chairman of UGC, and it vetted all the proposals which came to us, came to Ministry of Ayush. We never rejected any proposal. All proposals during that time, whatever came to us, entire thing was vetted and considered by this committee, and what was considered worth taking forward, it was given to the various research council as well as the persons who wanted to conduct research studies independently. For that, enabling provisions and gazette provisions were also issued by Ministry of Ayush, so that whatever is being done should be scientifically validated, and scientifically it should be having, and it should be having it well documented also. So all those enabling provisions were made continuously by Ministry of Ayush, and whatever the grievances were there, that were also resolved then and there. And that time also we propagated that no false claims of cure of COVID should be propagated, and we wrote to all the state government also that any false claim should be dealt with strictly. So all those things were propagated by Ministry of Ayush. Then Ministry of Ayush, as I told, that it formed an interdisciplinary task force chaired by Dr. Bhushar Patwardhan, and having scientists from various disciplines. The main purpose of this R&D task force to formulate and design clinical research protocols for prophylactic studies and add-on intervention in COVID-19 positive cases through review and consultative process of experts of high repute from different organizations across the country for studying 4 different interventions. In fact, 4 candidates we found that it will be very useful in the management of COVID. That is Ashwagandha, EHT Madhu, Guduchi plus Pipli, and polyherba formulation Ayush 64, because this is having antiviral properties, and it is found to be very useful in earlier in dengue-like conditions. The task force have taken up the proposal received from the screening committee of councils and proactively explored possibilities based on available leads. Ministry of Ayush has launched interdisciplinary studies involving Ayush intervention for COVID-19 based on recommendation of task force. Under various research organizations and national institutes under Ministry of Ayush, 105 research studies, including 60 Ayurveda studies, and 136 centers in the country are being conducted on Ayush intervention as prophylactic intervention into approximately 5 lakh population and as an add-on to standard care to COVID-19 management. Here I would like to add that all protocols which are required for like registration in CTRI, then data safety and management board, everything was followed clearly for all scientific studies, and whatever the steps is required for the management of for conducting scientific studies. Every step was followed for conducting the scientific study, taking it to the logical end. Then another initiative which Ministry of Ayush has taken, that it has released National Clinical Management Protocol based on Ayurveda and Yoga for management of COVID-19. It was prepared by National Task Force, which is in consensus from experts as per the report and recommendation of interdisciplinary committee, wherein guidelines for post-COVID care has also been mentioned. It was jointly released by Honorable Health Minister Dr. Harshvardhan and Honorable Ayush Minister Sri Shripad Yeso Naik ji. Then Ministry of Ayush and Ministry of Health and Family Welfare have jointly provided training to around 33,000 Ayush master trainers. Around 66,000 Ayush personnel has also obtained training at igot.in.gov.in platform on continual basis. Ministry of Ayush has coordinated with Ministry of Health and Family Welfare for utilization of Ayush manpower as COVID warriors for the management of COVID-19 with identified roles like clinical management, management of COVID centers, management of isolation centers, management of quarantine centers. So around 1 lakh Ayush personnel has been trained by state Ayush directors. Around 40,000 Ayush personnel are deployed for COVID-19, and others as and when requisition comes from the district administration, they are being deployed. Today, on the occasion of this webinar series, I am very much confident that that deliberation made during this webinar would portray Kerala's spectacular results in preventive, promotive, curative, and rehabilitative aspects of healthcare. I take this opportunity to convey my heartfelt wishes to the state government of Kerala and the organizer of this event with due respect to Srimati K. Shalja Teacher, Honorable Minister for Health and Family Welfare, Social Justice, Government of Kerala, and Dr. Shamila Mary Joseph, Secretary, Ministry, Department of Ayush, Government of Kerala. Thank you. Namaskar.
Thank you, sir, for that excellent presentation. Moving on to the next session, it's our great pleasure to introduce Dr. Vittal Huddar, a renowned physician presently working as an associate professor in the Department of Kaya Chikitsa at the All India Institute of Ayurveda, New Delhi. We request Dr. Huddar to present the topic Ayurveda in the existing management framework of NCDs, challenges and possibilities. Welcome, sir.
Thank you very much. I will be sharing the PPT just before starting this one. Hope you can see the screen. Okay. Respected dignitaries, Department of Ayush, Government of Kerala, and dignitaries, Ministry of Ayush, New Delhi, Ministry of Health and Family Welfare, Government of Kerala, and the participants. So now at this occasion, the topic given for me to highlight about and discuss about is the Ayurveda in the existing management of non-communicable diseases, that is challenges and the possibilities. So what we can do and what we are presently contributing for the non-communicable diseases, and what are the possibilities we can do, and later what are the challenges of that. So moving further, as all of you are aware that non-communicable diseases, which are very chronic diseases, these all are chronic diseases. Whenever a word comes as a chronic diseases, everyone looks towards the integration and particularly towards the Ayush system of medicines in India. So this is the cardiovascular diseases, cancers, COPD, that is the chronic respiratory diseases, diabetes, and these are the main 4 culprits in non-communicable diseases which are impacting the health system of India as well as all over the world. So there are few reasons where we need to check out where exactly we can intervene and we can modify the things and we can implement the strategy of improving these health strategies related to non-communicable disease management and control. So genetic causes, physiological causes, environmental causes, and behavioral causes are there. So in this, genetic and physiological, apart from that, we have our much role in behavioral changes and environmental at certain extent. So these two things can be looked upon to contribute as from the Ayush system of medicine, particularly Ayurveda I am dealing with. So these four group of diseases accounts for 80% of all premature non-communicable disease. That's why needs attention, because disease and all groups of people, especially the developing countries like India, they'll be the rate of these premature deaths is more as compared to the developed countries. And that is the worrying part, is the becoming common in young adults, that is 30 to 69 years, even in 30 age also. We are getting these nowadays because of working style and stress and other things. Many of them are getting diabetes, hypertension, and stress related many other diseases. So that is the alarming thing which need to be controlled and tactfully, and how we can achieve that is the challenge again. So these are that again I was the 41 million, that is 71% of deaths globally. This is 71% of deaths globally is because of non-communicable diseases, and 50 million die too young in 30 to 70 years, and good part of that is the majority of the premature deaths are preventable. So this is a very interesting part where we can the Ayush system of medicine that we can intervene here. So if you consider the modifiable, the behavioral risk factors, so that is the unhealthy diet, alcohol intake, and inactivity, and tobacco. So these are the major things which are impacting on these particular non-communicable diseases, which are modifiable. So as it is a preventable, these things can be taken care, and many other conditions like hypertension, metabolic risk factors are there, overweight, obesity, hyperglycemia, and hyperlipidemia, all are related to one or the other causes of these things. So these needs to be concentrated there. So as per our science also, Ayurveda, it has been very clearly mentioned the behavioral risk factors where the person commits the wrong things, what we are doing, the lifestyle and other things. On the headings they have mentioned as asatmendriyartha sanyoga, pradnyaparada, and parinama. Iti asatmendriyartha sanyoga, pradnyapah, parinamascheti samaha yoga yuktastu prakriti hetavu bhavanti. So what happens here, the asatmendriyartha sanyoga, the perception, what the things we are getting, it is either the over-utilization or non-utilization or wrong utilization of that. The indriyas, the sensory organs, what you are utilizing, that is to be properly used. So all these concept includes a broad thing for all the diseases, but particularly now we need to think on the non-communicable disease part of that. It's also true for that. And the pradnyaparada, we know the things are wrong, but still we commit a mistake. This happens a major of the times, and in the young adults also this because of addictions and all other things are there. They know that is bad for the health, but still they are committing the things, and the parinama based on the kala, the parinama kala. So at that particular things, so these are considered if samayoga yuktastu prakriti heto bhavanti. So once these things are controlled as far as possible, not as 100%, but these are going to take the person towards the prakriti, that it depends on that svak, manas, and sharira. That is what we talk, and from the inside of our heart, and also by the physical, both physical as well as mental care is to be taken on these aspects, which are considered to be a modifiable risk factor, which is in our hand to modify ourselves. So just a slide showing in the different conditions, like where we take these as a non-communicable diseases, Swasthya, Vruddharoga, Prameha, and Arbuda, cancerous conditions. So here, in the Ayurveda text also, it is well explained about the Patya and Apatya. Initially, they will explain Nidana, Parivarjana has been considered as the major line of treatment, as the initial line of treatment. Without that may not be possible to get the complete result. So all these aharas and viharas, which should not be done in Swasthya, Vruddharoga, Prameha, and Arbuda, has been very well elaborated in our text, which is very practical nowadays also. And based on this, the WHO has set the goal to 25% relative reduction in the risk of premature mortality from NCDs by 2025, and 1/3 reduction in premature deaths by 2030, and they recognize NCDs as a major challenge nowadays in the WHO. And Global Action Plan for the Prevention and Control of NCDs 2013 to 20, that PDF and the documentation is also available in the WHO website. So based on that, these are the objectives which have been set by the WHO. You can see how the Ayurveda and integration we can make it possible. That is all, it is depending upon the raise the priority according to the prevention and control of the non-communicable diseases that has been more highlighted, and to reduce the modifiable risk factors, as we are seeing the risk factors, the modifiable, this is the another objective, and strengthen and orient the health systems in particular state as well as in the national level, prevention and control of non-communicable diseases. So the prevention priority and the modifiable risk factors, all these areas we can work, we can join hands together, and we can make something change in the society regarding the non-communicable diseases in reducing the burden of health issues. To promote and support the national capacity for higher quality research is another area where we are also in that research area where non-communicable, All India Institute of Ayurveda is also working on this regard of non-communicable disease also in different collaborations with the different institutes. So here the research is also another one, and which is also challenging nowadays to generate the evidences. So overall, to look all these Asatmendriyartha Sanyoga and other behavioral things, the goals, if you see, all these are related to the Asatmendriyartha Sanyoga, Prajnapara and Parinam. That is 25% relative reduction in the risk of premature mortality, and 10% relative reduction in the harmful use of the alcohol, 10% relative reduction in the prevalence of insufficient physical activity, and relative reduction in mean population intake of salt and sodium, 30% relative reduction in prevalence of current tobacco use. So all these goal sets are related to the lifestyle. Most of them are related to the lifestyle, which are easily modified. Easily, no, I cannot say easily, but it is a tough job to do that. But still there is a way to go for these objectives with the help of the Ayurveda principles. So here, if you see the two parts, it's very clearly mentioned in that WHO document also, that is prevention and management, two aspects. So prevention I highlighted here because it is much concerned nowadays, Swasthya se Swasthya Rakshana and Atura se Vikara Prashamana. So here, Swasthya se Swasthya Rakshana has been given very prime importance in Ayurveda, physical as well as mental. If you go in thorough, it has been very clearly explained in all the aspects to prevent the many diseases, and it is true for Ayurveda also, and the management part is very thoroughly explained in Samhitas also. So the possibilities what we can make is in the preventive aspects, we can make adopting the rich and healthy culture of India. That is what the traditional medicine, what we say, Ayurveda principles of prevention and control of a disease. And in the management aspect, the standalone Ayurveda management are also available for non-communicable diseases, and integrative practices, which is a future medicine and having a scope, and a lot of works are going on at the government level and in the private sectors also. And palliative care is another aspect where the management role of Ayurveda will come in the picture. So you can see the prevention and control of these NCDs by lifestyle modification. So here a very nice quotation has been mentioned. Naro hitahara vihara sevi samikshakarihi vishayeshu asaktaha data samaha satyaparaha ksamavan aptopasevi cha bhaveti arogaha. So he has very clearly mentioned who is taking hitahara viharas. So proper diet and the lifestyle, and then once one is going to look about physical as well as mental. Both are considered here, not only the physical things, also the mental status has been considered in the health definition as per Ayurveda. So these are the key areas, and the very thoroughly the Dinacharya and Rutucharyas has been explained, but still these are on the documents, and for the present lifestyle may not be matching, but that can be modified for the present lifestyle and customized as per the state wise and the culture wise, because it depends from state to state, the culture. We cannot make standardized Dinacharya and Rutucharya in all the areas of the country. That can be done at the health administration level. So the Trayopastamba word has been used. These are main pillars which will decide our health: Ahara, Nidra and Brahmacharya. So these things, three things, if they are proper and side by side many other things are there, that will support for the health management. So diet, Astavida, Ahara Vishesh Ayatanani have been told how to consume the foods in different forms. Everything is very well explained. Due to time constraint, just I'm giving the glimpses for the prevention aspect of NCDs, what can be taken from the Ayurveda text. So Rutucharya has very clearly mentioned, as per the Rutus, what the lifestyle changes we have to do, what is to be taken, what diet is to be taken, when to go for exercises, when not to go for exercises, and particularly in the Rutu Sandhi Kalas, this is the Rutu Sandhi Kala where the winter has gone and the summer is coming. Particularly in Rutu Sandhi Kalas, we usually see the diseases are exploring at that time. Particularly stringent Rutucharyas can be identified, and that can be made into a protocols, and that can be made reach up to the primary health care level, so that will become a trend. Otherwise, that will not become a trend. So slowly it has to become an Indian tradition where we are following all these. For example, in Kerala, if we go and then after the marriage, they will give some kadas and all. So it is not prevalent in other areas also. So like when we practice these things, also making the protocols from the government side and the health aspects, so these will become as a tradition and a routine thing, which will definitely change the health status of the people. And the Sadvrata, that is the code of conduct, is very well explained, not only the physical things, also the mental things, like on the heading of the Achara Rasayana, that is behavioral therapy, has been explained. And all of we are aware that yoga and pranayama is also playing a very important role along with all what we are doing in Ayurveda. So this is the has been told in different diseases what is to be taken and what is not to be taken. As I have mentioned, Dinacharya from morning to evening from Danta Davana, the references are available about the Dinacharya, Ahara Nidra and Brahmacharya I have told. So by doing these things, he has mentioned clearly Shariram, Bala, Varna, Upachaya, Upachayopachitam Anuvartate Ayu Sanskarat. So here Sharira Bala, Varna, Upachaya, the metabolism, proper metabolism, complexion, everything will be maintained if we maintain Ahara, Swapna and Brahmacharya, Ahara Nidra and Brahmacharya properly. So Rutucharyas, I have explained it in the Rutu Sandhikalas, and also if any problems are there, how to manage those things, particularly as a preventive aspect. Preventive aspect management is also mentioned in Ayurveda, and this is the Sadvrata, as I have mentioned, the physical and mentally affecting wrong conducts. Now these are the stress factors which are leading to the NCDs nowadays. They are more common, so we need to concentrate on the Sadvrata as well as along with the physical things. So this is Achara Rasayana. I'm not going in detail, but very practically what was there on those days, and it is also still present in those days, which we are violating because of we are getting the stress. So that is to be taken care. So Achara Rasayana is a very one which important thing which has been explained, like sutras, that we can stick on our walls and we can try to follow those things. Such a wonderful things are there. So yoga and pranayama, I'm not going in detail with that. One of the major tool for prevention of any type of disease, especially lifestyle disorders nowadays. So many researches are also done, and Yoga Day is also celebrated worldwide, and everyone knows about it. So these are some of the publications are also done. It is not that only it is in the conceptual aspect. In the PubMed, we can get many research activities, consistent the modest benefits across a variety of important intermediate health outcomes, including blood pressure, low density lipoprotein, total cholesterol. These levels have been reduced based on the behavioral counseling to promote the healthful diet and physical activity. So this is one example just I am taking. So this is about the all prevention aspect, what we can do a major role, as I have discussed earlier, that can be taken as a challenge. And the management aspect, the detection, screening, and the treatment and palliative care, these things are told by the WHO. It is going on, and in that the treatment aspect and the palliative care. So here for different conditions like Pakshagata and many other neurological conditions, we are effectively using these all panchakarma modalities and oral medications in managing these conditions. And I'm just sharing here that we are having a collaboration with the All India Institute of Medical Science, New Delhi. Also, we have the projects related to the hemiplegia cases, and we have projects related to this one, the ongoing, the upcoming project from the Apollo Hospital, where the acute stroke cases will be, after the management of the ICU, will be referred to the Ayurveda hospitals, and that will be managed in All India Institute of Ayurveda, and it will be assessed again by the counterpart. So that type of integrative managements are going on. And in Hridroga, many, and in the cardiac disorders also, many preventive aspects, yoga, pranayama, many other things along with Virechana Basti. These all are going as integrative practices. And in Prameha and Madhumeha, lot of patients, and we have a lot of data also in our All India Institute of Ayurveda clinic, diabetes clinic, and we are successfully treating standalone as well as the integrative practice in cases of pre-diabetics and diabetic conditions. And in the respiratory conditions, we have collaborative researches with the Patel Chest Institute of New Delhi, like integrative works. Lot of works at the integrative level with the higher and high impact institutions. Work is going on in the field of Ayush. And this cancer also, we have MOU with IRCH, All Indian Institute of Medical Sciences, where we have taken up already with the ICMR sponsored project in breast cancer. Many other things are going on in cancer also. So if you look at these, the data, just we can get it in the PubMed if you search prospective trial of Ayurveda for a coronary artery disease. All these study designs are very well planned and published in PubMed, where they are having the significant results statistically. And in the journals, you can see the effect of Ayurveda intervention, lifestyle modification, and yoga in pre-diabetic and type 2 diabetes cases. Very significant results also found, and in a huge number of patients, 2,642 patients study has been done. And a few challenges what I wanted to highlight here are the collaborative research works. So this is a open-minded people, or the physicians or the surgeons, means they are the open-minded, mutual understanding and conception of the researchers. And this is a little bit challenging, but it is not impossible. Now it is possible. We are doing with the All Indian Institute of Medical Science, ILBS, and many other higher institutes with All Indian Institute of Ayurveda. So integrative practice using the concept of individual medicine and holistic approach of Ayurveda at a primary healthcare level also can be done. And here we can see the Ayurveda and the battle against chronic diseases, an opportunity for Ayurveda to go mainstream. It has been also published in a PubMed journal. So these are some of the workouts has been also be done, and many plans are also there. And research agenda for non-communicable disease prevention and control in India. What researches are to be done, that they have mentioned. They have taken these all questionnaires, 15 questions they have taken, and they have included all these top councils like Indian Council of Medical Research, Indian Institute of Public Health, Medanta, Ministry of Health and Family Welfare, and Tamil Nadu government, All India Institute of Ayurveda, Public Health Foundation of India, many other. They are telling that in the one question, what role can the system of Ayurveda, Yoga, and Naturopathy, Unani Siddha, and Homeopathy have in NCD prevention is also is important. They are considered as important, and it is going on. So finally, what the points needs to be considered, the non-communicable disease priority in healthcare is there, and prevention is the major key as compared to the management, and major role of Ayush system of medicines will be there, because chronic diseases, world is looking towards the integration, and particularly Ayush system of medicines, and integrative management is the future medicine, and collaborative researches and generation of scientific evidence is the need of the hour, and implementation at the level of primary health care centers is the challenge right now. So thank you, and I thank all the organizers of the government of Kerala and all the organizers for giving me an opportunity to share my views on this platform. Thank you.
Next session is Dr. Mangala Gauri V. Rao, Associate Professor at Benares Hindu University, Varanasi. She has an experience of more than 22 years and has done extensive research on Ayurvedic practices in geriatric care. She has published several books and many publications. Today she will speak on the topic evidence-based Ayurvedic practices to improve geriatric care. Madam, please stick to the time as we are running late. Your time is 15 minutes. Over to you, madam.
Thank you. Honorable dignitaries from all over India and abroad, enthusiasts of Ayurveda, it is my proud privilege to present before the scholarly gathering on the topic evidence-based Ayurvedic practices to improve geriatric care. Health in old age is associated with health in earlier age, that is from womb to tomb. In India, the old age population is increasing over time and it has increased up to 8.6% in 2011. Thus, it is getting the name aging nation. It is estimated that this population may increase to up to 324 million by 2050. Geriatric care is becoming a public health priority as the population of aged people is increasing with an enormous speed. About 39% of the old age people are suffering from one or the other kinds of the illness. Further, the NCDs with comorbid mental illnesses are growing public health problem amongst the elderly population of the country. The annual household cost of caring of the person with dementia is again increasing, like it is different for the urban as well as the rural India. For the urban population, it is up to 2,02,450 in the urban areas, while in the rural areas it is up to 60,000. And age-related frailty, which is again a major problem, which will be leading to many other diseases and disability, are increasing concerns of the population in low and the middle income countries like India. And the population census of 2011 also reveals that the locomotor and visual disability is most prevalent among the elderly population. Along with that, the heart diseases, urinary problems, diabetes, and many other non-communicable diseases are quite common. Further, the geriatric patients have many chronic comorbid conditions that will enhance the pocket expenditure of an individual, further leading to the financial burden for the government of India also. About 20% of the elderly suffer from common problems and their complications like cold, cough, fever, gastrointestinal disorientation, etc. So, on the whole, so many problems, but the Ayurveda has got an efficient answer in the way of prevention, management, as well as rehabilitation of these common ailments that occur during the elderly. What exactly? One is the way of life. As previously stressed upon by Dr. Huddar, the lifestyle, as mentioned in our classics, in the form of dinacharya, that is maybe in the form of pratimashanasya, abhyanga, vyayama, yoga, udvartana, and many more common measures that can be adopted by the community very easily, or emphasis upon the seasonal and regional food with the essential biopurification or panchakarma procedures as per requirement, and also the mental health promotion through the sadvritta or the ethical conduct, and physical and mental hygiene for the social harmony also, as well as certain important aspects in the lifestyle like avoiding the suppression of the natural urges, which are considered as the causative factor for the wide variety of disorders. All these things are quite cost effective, especially in a country like India, wherein the medicine costage may be more, but here it is just the lifestyle change that is going to enhance the quality of life of the all the age group individuals. There's a small study was conducted wherein the elderly population were surveyed for their lifestyle previously, that is in the form of exercise or yoga or intake of milk and ghee, adequate sleep, and body as well as head massage with oil. The study showed that the better quality of life was present in the people who regularly practice these simple dinacharya procedures compared to those who did not practice it. Then comes the healthy diet. Balanced diet, adequate intake of protein, energy, vitamin E, vitamin C, B6, folate, prevent the frailty. Again, as I told, frailty is a condition wherein the person becomes very weak and he is prone for many of the other diseases as well as the accidents or fractures, etc. So this can be prevented. And in Ayurveda, the Nitya Sevaniya Aharas have been mentioned, wherein they emphasize on the intake of the food items like rice, barley, which come under the cereals, and pulses like green gram, milk and ghee, meat of terrestrial animal, rock salt, Indian gooseberry or amla, honey, and rainwater regularly is uh, advocated for health promotion as well as disease prevention. So this is going to help all the age group people, including the elderly population. A study was conducted on the effect of milk and ghee, because milk and ghee is quite commonly used among all the community people in all over India. So this is considered as Ajastrika Rasayana or the Ahara Rasayana, that is rejuvenator. So this is going to enhance the Sharira Bala as per the classics. So a study was conducted, survey study was conducted involving the elderly population who consumed the milk for at least 5 years in their earlier period of life, and their Sharira Bala was measured. Along with that, the quality of life, hand grip strength, as well as endurance tests and fatigue tests all were conducted. And those who took the milk and ghee regularly, were having better Sharira Bala compared and quality of life compared to the others. Along with that, many of the cognitive impairment, disease prevalence was again significantly less in the people who consume milk and ghee regularly. So, milk and ghee, which is a non-pharmacological thing, so will be helpful in the healthy aging and can be incorporated into the daily diet of the elderly as well as in the all age group people. Further, it has been given in the classics that it enhances Smriti, Buddhi, Agni, Shukra, Oja, Kapha, Meda. So here the Smriti, which is one of the factor which is going to reduce as the age advances, and Agni is a factor which can prevent major of the diseases as well as they can enhance the longevity, and the Oja or the immunity factor. So all these things are going to be enhanced by the intake of Gogrita or the cow's ghee. So one has to encourage this intake of the ghee in a proper quantity. Then the commonly used spice like the rasona or garlic. This study was conducted on the hyperlipidemia patients, wherein the 6 to 7 grams of the rasona was given in the form of chutney along with the yogic practices, because lifestyle forms the most important aspect in the non-communicable diseases like dyslipidemia or cardiovascular diseases, hypertension, diabetes, so many factors. So this particular intake of the garlic helps in the management as well as prevention of the diseases. Further, this rasona or the garlic also helps in the reducing the weight, and it prevents the atherosclerosis, so that can be very much helpful, and at the same time it is having the rejuvenating effect. And one of the dietary items like barley or yavar is considered as best pathya for the diabetes. So the study was conducted on the diabetic patients. The various food preparations made from the barley along with the yogic practices, and a very effective result was got with this particular management. So exercise, nutrition, cognitive training, the geriatric management as well as rehabilitation are very effective in reducing the frailty. This is the research finding. So we have to adopt different kinds of the dinacharya that have been advocated in the form of vyayama or the yoga for the prevention of this frailty. Further, the rasayana is one among the important aspects for the management of the diseases as well as postponement of the aging. It has been mentioned, yat jara vyadi vinashanam. That is, it destroys the old age as well as the diseases. So here we cannot completely destroy the old age, but we can tell that this rasayanas will enhance the quality of life in the elderly people. How exactly this rasayana effect is brought about? Certain drugs have the effect of balya, brahmaniya, and jivaniya. That is, they enhance the strength or increase the dhatu or the different body tissues. The drugs like ashwagandha, bala act upon this, or certain drugs enhance the agni and enhance the absorption of the nutrition to the rasadi dhatus. For example, the drugs like rasona or the garlic or bhallataka, all these come under the drugs which enhance the agni. Or else it may clear the channels, as in case of bugulu or rasona. So altogether, it brings about the nourishment of the dhatus and health, longevity, as well as cure of the diseases when given according to the disease specific condition. Further, the many of the neurodegenerative changes as well as the cognitive defects are common during in the elderly population. Brahmi, which is one among the very good Medhya Rasayanas, is found to be quite effective in the Alzheimer's disease. It has shown to improve the memory, especially the associate learning and logical memory, and also it has reversed the phenytoin induced memory impairment in the experimental model. Further, Chyawanprash, which is one among the very famous rasayanas of the Ayurveda, again has multiple benefits which strengthens the respiratory system, especially in the elderly. As per classics, Kasa is considered one among the yapya, or that which is very difficult to cure by the common management, or else it is also having adaptogenic effect, also good for the cardiac problems. So all these multiple benefits are there with this Chyawanprash. So that can be used for preventive as well as curative purposes in the elderly. Then integrated yoga and Ayurveda rasayanas are effective in the cognitive functions in the elderly. Again, the Brahmi Ghata, when given in a dosage of 5 ml with the yogic practices, the intervention given for 8 weeks, helped in improving the memory as well as the learning ability. Further, the ashwagandha is again one among the very commonly available rasayana dravyas, and it is very effective against the lung adenocarcinoma, neurodegenerative disorders, Parkinson's disease, Alzheimer's disease, cognitive problems, as well as stress and hypertension, rheumatoid arthritis, and osteoarthritis. So long list is there. So this is very commonly available and can be very well used in the elderly population also. Further, many indigenous herbs are effective in the Alzheimer's disease. Again, amalaki, aparajita, ashwagandha, or the Medhya rasayanas like Shankapushpi, Guduchi, Yashtimadu, Vacha, Shatavari, etc. Or else other rasayanas like Kapikachu, Pushcha, Dashamula also can be very well used in the management of this Alzheimer's disease. Further, the Panchakarma is one among the most important aspects of Ayurveda, which is also concerned with the medical tourism also, and it is going to boost our economy also. So this kinds of the managements wherein the Panchakarma procedures, including certain Purva Karma procedures, will be quite beneficial in many of the problems related with the elderly. So a Matra Basti with 60 ml Ashwagandha Grita for 9 days showed quite promising results with the Womax arthritis index among the elderly suffering from the arthritis. So many more important works are there. Due to the scarcity of time, I'm not going to highlight all those things. And diabetes is one among the very important disease which is very prevalent in India. So the different Ayurvedic managements have been already, many studies have been already managed. One study we had conducted wherein the Prakriti specific herbal tea in the diabetes, like different Vata Prakriti, Pitta Prakriti, Kapha Prakriti, different herbal teas were given and their effect was taken out, and this found to be very effective. And because tea is one among the very common practices, instead of taking the tea, herbal tea can be very well introduced into our diet as well as the lifestyle. So to conclude, Ayurvedic lifestyle in the form of daily regimen, seasonal regimen, and the good codes of conduct should be adopted among the elderly. Along with that, the diet, regular exercise, abhyanga, and yogic practices, well adopted promotive, preventive, curative, and prehabilitative as well as rehabilitative measure for the elderly people. Rasayanas in the form of diet, medicine, and lifestyle are very important for management of the different problems related with the elderly. Further, variety of rasayanas, especially the amalaki, which is one among the Nitya Sevaniya Ahara Dravyas, or the Medhya rasayanas like Brahmi, Yastipadu, Mandukaparni, Shatavari, Shankapushpi, Lashuna, Ashwagandha, etc., are quite beneficial in variety of the ailments that are common among the elderly people. And Purva Karma as well as Panchakarma procedures can be used as per condition for the management of many geriatric illnesses. So, to conclude, the holistic approach of Ayurveda can help to improve the geriatric care in the entire country and bring about a very good effect to the geriatric people. So I thank the organizers, especially the Ministry of Health and Family Welfare, Government of Kerala, for providing me this opportunity to uh, present my views on this important topic. Thank you very much.
Thank you, ma'am, for the insights on the vast prospects of Ayurveda in geriatric care. We now move on to the next session by Dr. Ramesh PR, Chief of Clinical Research, Ayurvedashala, Kotikal. He has a vast experience of more than 3 decades in Ayurvedic practice and research. He is a member of various academic committees and task forces and is also a visiting faculty in the Department of Integrative Medicine at the University of Duisburg, Essen, Germany. Sir, I request you to make your presentation on the topic, an integrative approach to pain and palliative care, what Ayurveda can contribute. Welcome, sir.
Thank you. Thank you, madam. Let me share the screen. Then. Respected Minister, other dignitaries of Department of Ayush, and my dear friends. I'm just sharing my experiences in the integrative approach of pain and palliative care and what Ayurveda can contribute with the experience in Ayurvedashala. So I'm going to discuss about Ayurveda, disease transition, pain and palliative care, ethics, Ayurvedashala's experience, personal experience, research publications, future plan and conclusion. So we all know that traditional medical system of India is Ayurveda, widely practiced uninterruptedly, and there are codified literature in Ayurveda, and it is the first organized form of medicine in the planet and continues still a vibrant system for millions. And if you see the present health scenario, there is a transition from communicable to non-communicable lifestyle disorders. But if you see with chronic ill health, with disability and dementia together makes the situation very worse. So people need support here. So actually, if you see the palliative care area, more than 30 million people suffer unnecessarily from severe pain and symptoms each year. But we have this knowledge, but we need to reach for the help. And the definition of palliative care is that it is an approach that improves the quality of life and their families facing the problem associated with life-threatening diseases through prevention, relief, and suffering by means of identification and impeccable assessment and treatment of pain and other problems, physical, psychosocial, and spiritual. And if you take the status of India, less than 1% of its population has access to pain and palliative care, even though we have huge population. And if you see the distribution of adults who need palliative care, the most common one is the cardiovascular disease, not the cancer area. But afterwards, it comes malignant neoplasms. Cardiovascular is more than 47%. Then comes COPD. Then comes all other areas of Parkinson's, rheumatoid arthritis, nephritis, cirrhosis, all as you see here. And if you see in an Ayurvedic practice, day-to-day practice, now all these kind of people come to us. Paralysis of varied etiology, autoimmune problems, myopathies, myelopathies, psoriatic arthritis, cerebral palsy, then sensory motor neuropathy, chronic liver, kidney disorders, motor neuron disease, age-related disease, cancer, and so on. So here, I'm just mentioning with one shloka of ethics mentioned in Ayurveda. The patient, this is from Sushruta Samhita, very beautifully describes about ethics. The patient may distrust his mother, father, sons, relatives, but he put himself in physician's hands with complete trust. So the physician therefore should safeguard him like a son or daughter, which is very, very clear. And in cancer clinic in Ayurveda, because in Ayurveda Shala, we have, it's a 119-year-old organization, and it's a charitable organization, but we started the cancer clinic in 1999, and slowly it started increasing the number of patients. Now we have 1,500 to 1,600 patients per month and 60 patients per day. Last January, due to the COVID scenario, because of immunocompromised patients, traveling restrictions and all, the patient number has slightly decreased. And we have 4 categories of patients approaching us, all cancer patients. One is follow-up cases. After successful conventional therapy, approaches for preventive care. Those who are non-responsive to conventional therapy come for Ayurveda as a last resort, and follow-up cases with undesired effects of conventional therapies, with or without metastasis, and cases approaching solely for Ayurveda treatment. That is the 4th category. And if you see the age-wise distribution, above 50 patients are more, 69%. Others are like this. And if you, the review of cases, you can see the last 5 years, number of cases in each category. But here we can see that CA breast and CA lung cases are more approaching us. And here in last year, you can see that in 2019-20, more than 16,000 cases have visited our clinic. And we address all these symptoms: pain, anorexia, vomiting, constipation, diarrhea, cachexia, urine retention, incontinence, lymphedema, and breathlessness, cough, and delirium. So when we see the management of pain, of course, in Ayurveda, very strong medicines are not there. But in nociceptive and neuropathic pain, to a certain extent, oral medication, external applications are very much effective. And in central pain and in very severe condition, we may have to go for morphine and other measures in modern medicine, WHO analgesic ladder and such things we may have to implement, or we may have to refer the case. And in treatment modalities, what we adopt is all conventional treatments like Shamana Chikitsa, which is palliative, Shodhana Chikitsa, which is a purificatory therapy like Panchakarma and all, if it suits for the patient. And symptomatic treatments, empirical and home remedies, lifestyle modifications, dietary alterations, and relaxation techniques like Yoga Nidra, breathing exercises, meditations, etc. And the prime importance is given that this is a basic principle in Ayurveda, importance of protecting immunity. Always protect and modulate the immune system to improve the efficacy of your treatment. And if you take the clinical experience, I'm going very, very quickly. Two cases, I'm just, because so many cases are there, but this is two cases just to say that it's a 10-year-old boy with pontine glioma, approached us in 2014. But you can see that he has undergone the RT, radiation therapy, but then took the Ayurvedic treatment. In every year we were taking the MRI brain. You can see the size of that tumor, 2013, 2014, 2015 again, 2017 again, and 2019 also. The size has slightly reduced, but not much difference. But the quality of life, you see the initial complaints and present complaints: imbalance while walking, weakness of right limb, recurrent headache, and excessive salivation. All these symptoms have considerably reduced, and he is now able to walk and play shuttle badminton after the inpatient therapy we gave him last year. And according to his neurosurgeon from Ramachandra Medical College, Chennai, he expected only 4 months survival of the case. Now it is the 7th year he is living with good quality of life. And this is another person from USA, an American naval officer, 55-year-old CA Colin with ulcerative colitis. He came actually in 2006, but he was having a complicated case with profuse bleeding per rectum. He was allergic to many allopathic medicine, and he underwent a total proctocolectomy in 2001, and ileoanal anastomosis with J pouch was performed. But unfortunately, after this, the ileoanal pull through developed and significant pain while defecation and bleeding was there. I was really skeptical to take this claim, but a surgeon brought him, and we took the case and did the treatment. And after 28 days treatment, there was substantial improvement in the rectal bleeding and inflammation. Pain on defecation subsided, and continued Ayurveda medicine for next 3 months, because I contacted his personal physician in USA, and they agreed to continue the medicine, and it was completely recovered. But the same person visited us again after 6 years when he has testicular cancer with post-surgery and chemotherapy. Obstructed micturition with perineal pain, edema, pus-like discharge from penis, and Klebsiella infection was also there, and he was not at all responding to any antibiotics. We gave 28 days Ayurveda treatment as a purificatory therapy, but then we also could not control the infection. But again, we had a discussion with his doctor in USA. He said that after purification, can we retry the same antibiotics, and tried the same antibiotics, and that helped him. The infection subsided. Why I am putting this case, when two systems combine together judiciously in a proper way with an open mind, that helps patients to improve their quality of life. And these are certain research papers I'm just mentioning. This was conducted by me only in Pain and Palliative Care Society in Calicut Medical College, managing morphine-induced constipation and controlled comparison. This was published in the Journal of Pain and Symptom Management in Elsevier Science series, and where the digital evacuation in morphine-induced constipation was very common, which is an unpleasant job both for doctors and patients. But after introducing the Mishraga Sneham, with these studies available, the digital evacuation considerably reduced in that clinic. This is again another example for integrative approach. And this is Ayurveda Shala is involved in so many research projects. This is Amalaki Rasayana. 3 papers have been published in peer-reviewed scientific journals. One is in human model, another is a fruit fly model, and next is mouse model. In human model, healthy aging by DNA repair was established. Then in fruit fly model, enhanced life expectancy, increased fecundity, resistance to starvation, tolerance of temperature was established. And mouse model was a really wonderful cardiac protection and beneficial effect of myocardial energetics and muscle contractile function was established. These are all published in scientific journals. And this is the recently published journal from our CMPR, Center for Medicinal Plant Research, in 2020 July. Gulgulu Tiktam, it's a classical preparation. Phytochemicals are identified which has anti-cancer property as well as immunomodulatory property. This is a published paper. And now some observations to conclude is that improves the quality of life with minimum undesired effect. And many number of cases we have observed that in PET scan, the metabolically active lesion has come down to less metabolically active or metabolically inactive. Helps in reducing the undesired effects of conventional therapy and able to complement modern medicine in many areas of palliative care. Many patients are solely on Ayurveda medicine, but our weakness is inadequacies in emergency management. So now we are into research. This is the research project, a collaborative cancer research project with the help of Indian Institute of Science and MVR Cancer and Research Center, which is a modern oncology institute. So Ayurveda Shala will prepare the Ayurvedic formulation, standardization, recruiting patients and conducting clinical trials with the help of MVR Center. They will help us in evaluation, and in the Institute of Science will help us in animal study and cell line studies. So we are in search of fund for this, a very, very important project. So ultimately, what is palliative care is that we are improving the quality of life. The green line shows the hopes and ambitions of patients, whereas the reality shows the red line. The gap between this is the quality of life. If we are modifying the expectations of the patients and improving the circumstances of the patient by our treatment and other aspects, the quality of life improves. And finally, this is the role of physician in palliative care, the 16th century aphorism by an anonymous author: to cure sometimes, to relieve often, and to comfort always. And I'm indeed very much thankful for the government of Kerala and the Ministry of Ayush, especially Ayush Ministry, for giving me an opportunity in this platform. Thank you very much, ma'am. Thank you. Thank you.
Thank you, sir, for your very informative session. So, ladies and gentlemen, that was the last session of today's scientific session. Now we have few queries, but due to the time limit, we will restrict to one. So the question is to Dr. Ramesh, sir. In your experience, sir, what type of cancers respond well to Ayurvedic management, and which all cancer management should people approach for Ayurveda?
It's a very, very good question, but my experience, I'll tell you, as the accepted treatments are the conventional treatments like modern medicine treatment, like radiation, chemotherapy, and surgery, people generally, because I showed 4 categories of very less people directly come for Ayurveda. But we very, very, very honestly, with ethics, we are practicing. For example, if a breast cancer comes in the initial phase, surgery and chemotherapy, that management is the best way. But in certain conditions where nothing is helping them, those conditions we have, many cases we have responded very well. And another area is that now we are going to conduct the research in that area in non-small cell lung CA, that we especially with AGFR negative mutation, there are no treatments in modern medicine. That is, we have so many discussions with modern medicine oncologists in MVR Cancer Center. So we are having so many people having the same way, but they come in 3rd stage or 4th stage. But in many number of them, their lifespan, because usually 7 months is the expected lifespan, but many of them have more than 20 months they have lived comfortably with good quality of life. So that is the area that we are concentrating. So with an open mind, I would like to tell that each cancer is different, each body is different, each body's response is different. So only after evaluating, especially in geriatric type of cancer, I showed you many of them are above 50-year-old, we were able to help them to improve their quality of life. That's what I have to answer. Thank you.
Okay, thank you, sir. Thank you, sir, for the valuable information. So I thank all the esteemed speakers for their excellent presentations. Their suggestions, I am sure, can be adopted and adapted in the Kerala Ayurvedic management policies. So thank you all. There ends our scientific session. And now we move on to our panel discussion. So now we move to the panel discussion on Kerala Ayurveda in global health, programs, policies, and partners. The panel will be chaired by Dr. Rajan Kobragade, IAS, Principal Secretary, Department of Health and Family Welfare, Government of Kerala, and co-chaired by Dr. Sharmila Mary Joseph, IAS, Secretary, Department of Ayush, Government of Kerala. Panel includes Dr. P.N. Warrior, Dr. Hemant Nutulapati, Dr. Jayan D, Dr. Rajesh Nilamana, and Dr. Rajmohan V. We now welcome Dr. Unnikrishnan Payyamballimana, Visiting Professor, Transdisciplinary University, Bangalore, Karnataka, to moderate the session. He has completed his PhD in International Development at the Yokohama National University and was a research coordinator in the Education for Sustainable Development Program at the United Nations University Institute for Advanced Study of Sustainability. Welcome, sir. We have Dr. Divya S. Iyer, IAS, State Mission Manager, Director, National Ayush Mission, Government of Kerala, to introduce the topic for discussion. Dr. Divya too is a medical doctor by training who joined IAS in 2013. Dr. Divya joined NAM only recently, despite her short tenure here, she has been able to infuse energy into the activities of NAM. The theme for the panel today is Kerala Ayurveda and Global Health Programs, Policies and Partners. The theme is significant in the current pandemic situation also, as Ayurvedic protocols have been widely used to boost the immunity of our population. May I request Dr. Divya to introduce the theme.
Warm greetings to everyone. As we are already running short of time, I think without much ado, I'll start my theme introduction. Can we load the presentation, please? Is it visible? Yeah. Yeah, so I don't think I need to elaborate this slide to an audience and to a panel like this. We are definitely familiar with the Dinacharya and Ritucharya and Panchakarma and Rasayana and various modalities of treatment, as well as various ways of life and living towards health and wellness in Ayurveda. Certain areas which has already been mentioned, and some of them have been mentioned in the scientific session previously, we know where Ayurvedic interventions and approach has proven to be extremely beneficial to the population, especially in Kerala, are these, which includes cancer, cachexia, various neuropathies, complications arising out of chemotherapy in cancer treatment, in cases where there is deterioration in tuberculosis, in chronic autoimmune diseases, and in different stages of degenerative and cognitive diseases, as has been presented with evidence in the previous scientific sessions as well. In Kerala, we've had several flagship programs which has met with a huge amount of success as well as acceptance amongst our population. Some of them being the Prasadam, which is meant to target anemia in school-going children, especially between children aged 6 to 15. Susmritam, Punarnava and Jeevani, which has already been explained by our Secretary Ma'am in her presentation. Now, all these programs, all these ways of lives which Ayurveda presents us with is available to probably every single state in this country or even to all the countries across the globe. So what is it that makes Kerala different and what is it that makes us stand out in the crowd? That is where I think we need to crack our secret, and that is where we need to capitalize upon in order to become the world leader in Ayurveda. and present this enormous gift of Ayurveda to the rest of the world. Let me narrate a quick experience from my own personal life to put things in perspective. I was walking down the road where I stay. I live in a very typical urban setting in Trivandrum, which is the capital of Kerala, the southernmost state in the country. I was walking down the road in this urban setting with my aunt. And to my surprise, within 10 minutes, she pointed out 10 different plants that were growing by the side of the road amongst the cracks, probably in the tarred road or by the side, or which was growing wildly, which one would probably mistake for just weeds or just useless plants. She pointed out 10 different plants to me and told me immediately what was each one effective for and what is it being used for, and how these plants are actually being left unattended to in today's age and era. And if this is the experience in the urban setting, imagine the potential in rural setting. Let me give you another example to substantiate this. One of our own state program managers in the National Ayush Mission, when he was here, he was narrating this story to me when he said that he used to go to schools in order to conduct awareness classes on Ayurveda. And there was one quick exercise that he would ask the students to do before he would go there, which is to make a quick compilation of all the medicinal plants which they can recognize inside the school as well as in and around the school, in and around their households or in their villages or their panchayats. And a prize would be given for the student who identifies the maximum number of medicinal plants and to write down one use each of each plant. Now, these might sound like very silly, experiences, but I want to tell you that this is actually the secret of Kerala as far as Ayurveda goes. This is the strength of Kerala as far as Ayurveda goes, because this is a community, this is a population which has had faith in this system of medicine for innumerable number of years. And this knowledge has been actually handed over from generations to generations. The two examples that I give happened at almost, same period of time. But one person I was talking to belonged to probably the yesteryear's generation. And the other experience actually enumerates the kind of interest and the kind of knowledge and awareness that children and students of today's age and era have about Ayurveda as well as medicinal plants. So this is probably the area that we need to capitalize on, because for any system of medicine, for any school of medicine, the biggest secret to healing and curing is faith in that system of medicine and the right awareness amongst the population. It is not just awareness about the plants or the use of various plants, not just awareness about diseases, but the awareness that translates into health-seeking behavior. And that is what we need to discuss when we talk about Kerala becoming a global leader. Now, when I talk about Kerala being the global leader, the current example that I would want to cite is the Ayurvedic response to COVID-19 in Kerala. As was even mentioned by our respected Secretary Government of India during his talk, the kind of response that Kerala has had in the COVID-19 pandemic has been laudable in the Ayush sector as well. The readiness and preparedness to face the COVID-19 pandemic was lauded to be extremely proactive. It was not a reactive strategy, but we had a proactive strategy. Right from our organizational chart, we had a state Ayurveda response cell, which was not confined to the state level, but it would go to every single level down the lane as far as the treatment and the therapies as well as spreading awareness was concerned. Some of this has already been mentioned, so let me just quickly run through this without taking much time. We had Ayur Raksha clinics, which were the basic units of implementation of various COVID-related activities, which were spread across the state of Kerala. And there was an online facility connecting various levels of these strategy, of these various rungs of the ladder. It was called Niramaya, which was easily accessible to our entire population. And probably the big hit of our COVID-19 pandemic was met with Ayurvedic prophylactic strategies for general population in the name of Swasthya and Sughayushyam for various age groups. Amritam was again spoken about in the previous presentations, which was targeted Ayurvedic prophylactic strategies for quarantined individuals. And when it came to treatment, we had the Bheshajam as well as Punarjani, which was for the post-COVID ailment. So altogether, put together, we had around 1.8 million beneficiaries of Ayurveda in the COVID-19 pandemic scenario, which definitely is a huge number as far as these troubled times are concerned. So we had several benefits of the programs. Let me quickly run through a couple of data points to intrigue your interest. As was mentioned by our secretary earlier on, this is open to discussion, and these are our preliminary findings that I'm presenting. So when we talk about coverage of Amritam, which is the project for quarantined individuals, we had a target population which crossed over 1 lakh individuals. And certain districts definitely did much better when compared to the other. Now, comparison of quarantined individuals who turned positive for the COVID-19, for the SARS-CoV-2 infection, actually showed pretty encouraging results for us. There was a low positivity rate for those who were under the Ayurvedic prophylactic strategies. And you can see that the line in orange, which shows the 1.35 to 1.61, those are the non-APS positive percentage, and the APS positive percentage is significantly lower, and you can see it is 0.32 to 0.34. Now, when we actually looked at the symptomatic individuals, which was 168, when we looked at the number of symptomatic individuals who had taken the Ayurvedic prophylactic strategies, we figured out that there was a very interesting trend that we could see, which was that there was a significant positive correlation with an R of 0.99 and a p-value which was less than 0.05, of course. And this existed between the ratio of asymptomatic to symptomatic cases amongst people who had actually turned positive. Now, this was definitely correlated with the duration of the prophylactic strategies that was administered. So for those who had taken the prophylactic strategies for more than 15 days, the percentage had significantly reduced, and this was found to be statistically significant, as is revealed from the significant sloping in the graph as well. So just one more data point to just intrigue your brain, which was the data that we had got under Punarjani, which was the post-COVID treatment under Ayurveda. Again, the results were actually very encouraging. Almost 99% of the population who had undertaken our treatment became asymptomatic within 30 days or within 1 month of administration. So that is just one example. Since the theme talks about programs and policies and partners, I thought we should definitely start with the programs. And this is one program that I would want to highlight here when we start discussing about how to pitch in Kerala as a global leader in Ayurveda. And now coming to policies, I'm certain that most of you know these points, so I'm not going into the details. These are generic points that you would have already known. Ayurveda has got recognized presence in 48 countries, and Kerala has a major market share in the global Ayurveda industry as well. And when it comes to medical value tourism or health tourism, citizens from at least 50 countries visit Kerala year after year for health tourism, which again capitalizes or which leverages from our Ayurvedic history as well as our Ayurvedic facilities and services offered here in Kerala. Again, the policy bit, I'm not going into the details. We all know the policies of WHO as far as health is concerned. And in India, definitely we are lucky to be in a phase where Ayurveda, yoga, and all the various components of Ayush have got a resurgence and has probably never been more prominent in the history of modern India before this. So at the policy level, we are seeing very encouraging results, and this is the right time for us to rise to be the global leader as well. So a few points to leave you with in order to discuss over this panel discussion. How do we transform Ayurveda for an individualized, evidence-based and integrative or pluralistic health system in Kerala, catering to the customized needs of each individual? How to create globally acclaimed and empirical models for the various niche areas which we could look into, which was discussed in the previous scientific sessions as well. Promoting Kerala Ayurveda as a brand in medical value tourism or health tourism, and augmenting Ayurveda-based herbal drug trade. as I had mentioned right in the beginning, wherein how to leverage the knowledge and the interest and the awareness of the common people in order to actually enhance the relevance and significance of Ayurveda in our day-to-day life. So I'm certain that our collaboration with various international universities, especially in Japan, Korea, in the European Union, which we already have, and various other countries, which we are looking forward to handhold with in this field, will definitely come in handy for us. And I seek your active participation in this panel discussion. With these words, my heartfelt gratitude for this wonderful opportunity, and I wish the entire team in the panel as well as Swasthya webinar a very fruitful time. Thank you so much.
Thank you, ma'am. I now request Dr. Unikrishnan Payyapallimana, moderator, to introduce the panel members. Over to you, sir.
Thank you, honorable dignitaries from the Ministry of Health, Government of Kerala, esteemed guests and panelists of the discussion. First of all, thank you very much for inviting me to moderate this session. After a series of rich technical presentations on the role of Ayush on the diverse dimensions of clinical medicine and public health, including wellness, non-communicable diseases, geriatric care, and palliative care, we have an eminent panel of experts who will share their experience of 5 different domains of Ayurveda sector in Kerala, such as clinical practice, pharmaceutical industry, Ayurveda medical education and research. They'll be specifically focusing on the strength of these sectors in globalizing Kerala in Ayurveda. We have just had a very rich context setting by the National Mission, Ayurvedic Mission, Ayush Mission, State Mission Director. So without further delay, may I invite Dr. P. Madhavan Kuttivariyar to share his views on the status and potential from the perspective of Ayurveda clinical practice and pharmaceutical industry. Dr. Madhavan Kuttivariyar needs no introduction. He is the chief physician of Ayurvedishala since 2019 and a member of Board of Trustees since 2009. He is also the president of Travancore Cochin Medical Council of Indigenous Medicine in Kerala. So, Dr. Madhavan Kuttivariyar, please.
Thank you, Dr. Unikrishnan. I hope I am audible. Hello.
Yeah, yes, you are, sir.
Thank
you
you.
are audible.
Thank you.
Yeah.
Respected session chairman, Dr. Rajan Gobrikade, Principal Secretary Health, and co-chairperson, Dr. Sharmila Mary Joseph, Ayush Secretary, and other dignitaries and participants. A very good evening to one and all. The Ayurvedic sector in general is witnessing a touch of buoyancy and anticipation all across the country. A renewed sense of vigor and enthusiasm are evident amongst the practitioners and other professionals. There is an increased awareness about the clinical and therapeutic capabilities of Ayurveda among the general public as well as among the policymakers and health managers. After several decades of independence, this Indian heritage is now receiving favorable patronage from the official circles too. Formal and authentic efforts are being made to expand the scope and reach of Ayurvedic clinic and pharmaceuticals. And what gives me a sense of optimistic enthusiasm is the larger volumes of research efforts being made by the academicians to strengthen the knowledge base of Ayurveda. Kerala has a long tradition of maintaining and sustaining the authentic mode of Ayurvedic practice. Naturally, the new enthusiasm is evident in Kerala too. Kerala's track record in retaining and formalizing the Panchakarma therapy is well recognized. Additionally, the unique Kerala practices of Panchakarma have also come to be globally known. It is in this background that the global perspective of Kerala Ayurveda should be viewed. As mentioned, Kerala's track record in establishing the accessibility and affordability of Ayurveda therapies is globally recognized. Kerala, in fact, is designated as a health hub for Ayurveda. The state has already been recognized as a Ayurveda destination for the global traveler. As far as classical medicaments are concerned, Kerala can be proud of some of the major manufacturers of the country. But maybe there are something more to be done. Presently, a major segment of foreigners who come to Kerala seeking Ayurveda are mostly holiday seekers and casual travelers. While retaining that segment, efforts should be made to further focus on the capability of Ayurveda to treat and give palliation from debilitating ailments. Then only will full potential of Ayurveda be utilized. For achieving this long-term objective, the government and other stakeholders should make joint efforts to improve the global awareness about the healing capabilities of Ayurveda and also to upgrade the quality of clinical services to global standards. In the case of medicaments, concerted efforts need to be made for generate globally acceptable evidence data for the time-tested medicaments and to attempt to get them registered with the regulatory agencies of foreign nations. We must also realize that there are too many challenges confronting us while trying to implement a long-term plan to achieve the above objective. Primarily, there should be a cadre of young professionals equipped with not only Ayurvedic knowledge, but with other managerial talent and skill. The government should be able to lead this effort from the front by conceptualizing and implementing an effective plan with clarity defined objectives and methods. And the role of the organized sector, including drug manufacturers, hospitals, universities, and professionals, associations, etc., also is important. I have attempted to here just to put forth a few preliminary ideas for the kind consideration of the participant and for further discussion. Thank you for giving me this chance. Thank you very much.
So, Unnikrishnan sir.
Yeah, thank you, Dr. Warrior, for that excellent introductory comments. Now we have Dr. Hemant Nuthalapadi. He will be speaking about the international collaboration. Dr. Hemant is an assistant professor and concurrently the research administrator at Shimane University in Japan. His scientific research is primarily oriented towards developing early diagnostic procedures for cancer and other diseases using Raman spectroscopy. As a research administrator, he promotes joint international research collaborations between Shimane University and institutions worldwide. Dr. Hemant, please.
Thank you very much for the nice introduction. Am I audible now?
Yes, yes, you are audible.
First, let me thank the organizers for putting together this wonderful program and for the invitation to participate in this elite panel. It is indeed a huge honor. I would like to take this opportunity to stress on the need for promotion of Indo-Japan research collaborations in the field of Ayurveda. And I will try to put it into the context of today's theme, Kerala Ayurveda in Global Health Programs, Policies and Partners. So I would like to briefly mention about why Japan needs Kerala Ayurveda. What is the present scenario of Ayurveda here? What are the challenges to introduce Ayurveda? And a few points on what should be done. Why Japan needs Ayurveda? Most of us have heard about very high life expectancy in Japan. In fact, it is one of the best in the world with an average life expectancy of 85 years. But to have a better understanding of the Japanese society, we must look into the current demographics. Let me put it into some context to you to show you the need and the urgency of Japanese society has for traditional medicine such as Ayurveda. Say the current population is in Japan is 125-26 million, which is about 1/10 of Indian population. But the median age is 48 years, which is very high. And Japan has the highest proportion of elderly citizens in any country. That translates to about 30%. About 30% is population is over 65 years old. And it is estimated by 2050 that number will go up to 40%. 40% will be over 65 years old. That's very huge. But on the other hand, the proportion of young people, for example, under 15, right now is very low at 10, 11% or so. And the situation is further complicated because the birth rates are declining in the recent years, and it's getting very complicated. So we can actually call Japan as a super aging society, not just aging society. Because Dr. Rao in previous discussion also was talking about geriatric care and so on. But in India, I think it's nothing. But in Japan, it's kind of alarming already. And such demography has severe economic consequences for any country. So particularly the per capita health spending by the government here, I think is about 3,000 or $3,500 or something. And it is actually expected to increase to over $6,000 by 2050. That is really huge, and that is not sustainable. So therefore, to mitigate the situation and reduce the health costs, and promoting health and wellness holistically is, I think, the only way forward. And that is where I believe Ayurveda has a very important role to play. So what is the present scenario of Ayurveda here? Well, do people know in Japan about Ayurveda? I must say there is some degree of awareness about Ayurveda among public, but without knowing the word Ayurveda itself. For example, if you say herbal oil, aromatherapy, etc., people understand. But those are treated as exotic and kind of expensive and catering only to the rich. So in general, I would say there is no knowledge of Ayurveda as an independent medical system at all. And with respect to Ayurveda research, there were and are a few researchers in Japan, but the number, I think, is, honestly, is negligible, probably less than 10. On the other hand, it is also claimed that Japan has the largest number of Ayurveda practitioners outside of India. Perhaps in a very limited sense or limited definition, it could be true. But again, I would say not as an independent, reliable medical system at all. So if we have to really, as the mission director just mentioned, how to leverage and what should we do to introduce Kerala Ayurveda. So I think there are several major challenges. From where I see as a professor and a research administrator, I can tell you some very important 3 points. I think lack of awareness about Ayurveda is the primary problem, but particularly the lack of awareness among researchers and clinicians. The number 2 is establishing evidence-based practices. I think everybody in this session are talking about evidence-based practices. That's fine, but in Japanese context, that is very important. I think by that, what I mean is we probably have to even get evidences from this population. Even if it is true to another population, Japanese will not really accept it. And also, I think packaging Ayurveda according to the local needs. So Ayurveda, with what that is in India or in Kerala, cannot be really imported as it is to Japan. So we need to probably repackage it according to the local needs. And so also introducing the whole concept of Ayurveda, I think, may not be very effective at all. So instead, we can probably create some very specific targeted programs, for example, the geriatric care or so, where we can probably have very high, it will help if we target, for example, the geriatric care, then it will give us good acceptance among the public. So because of the, given demographics after all. And so anyways, these are the major challenges, but to make it mainstream. But what are the future directions? What should we do? So in short term, I think we need to promote international exchanges of say students, researchers, clinicians, practitioners, anybody who is related to Ayurveda, to bring awareness so that they can talk to the Japanese counterparts just to show what is possible, what is not possible, and so on. In fact, this was originally, this discussion started when I had the opportunity to invite Honorable Chief Minister of Kerala to Shimane University during his visit a couple of years ago. And that led to really strong discussion to start research collaboration. Well, we are already doing a little bit of that, but then what else? So we need to really identify potential research collaborators and institutions in Kerala and in Japan, and then we need to really focusedly support them. And I must say, actually, last year I had, with the help of, it's a very strong support of Honorable Health Minister, Shailaja Madam, and her very active team. I was really surprised to see how active they are when I visited last year. And they really made the visit very easy to all the Ayurveda colleges. And now I also have this idea of how to actually bring it back and introduce to the researchers here. Well, that is also, just in the beginning phases, but we need to also establish, I think in the next step would be establishing an Ayush chair, for example, here, so that we can create dedicated research programs. And to top it off, we need to provide some kind of financial support to carry out research, both in basic as well as clinical research. So the main points I want to say is that, in terms of how they can help, how Japan can help or support, is that the Japanese counterparts can help in testing effectiveness of formulations using state-of-the-art facilities here, designing fixed combinations of herbs, standardization proportions, and so on, and also primarily help in publishing research papers in reputed journals, so that which is very crucial. But in the long term, there are so many things to discuss, but just very important that I wanted to say is translation of important Ayurveda textbooks into Japanese language. I think that's a long way to go. And also establishing joint research and education centers together with the Japanese university, so that we can create the ecosystem and promote Ayurveda holistically. And also, of course, use the obtained results to get clearances and certifications and so on, so that we can also import and even grow herbs eventually here. But I want to conclude by saying, if Ayurveda has to be accepted by larger population as a reliable medical system here, it should come through Japanese researchers and institutions of good reputation. Otherwise, it will remain unknown and exotic. Therefore, research collaborations is a first step, it's a must, I think. And once there are some positive results, then we'll be able to actually use it to promote it in both education and health sectors. And finally, as a researcher myself, I do Raman spectroscopy and I do cell work all the time, single cell work. So I'll be very happy to also personally help, collaborate for any single cell measurements in my laboratory. Yeah, thank you very much for the opportunity.
And thank you very much, Dr. Hemant, for succinctly putting that those thoughts. I would like to add that Japan has two collaborating centers of WHO, one the Kitasato University, the other one earlier called Toyama Medical and Pharmaceutical University. And you'll be interested to know that from the late 1960s, Japan has already an Ayurvedic society led by Professor Namba, Professor Teresawa, and Professor Tasawa. So, but also thank you for highlighting how important in geriatric care Ayurveda could be in Japan. Because Japan is a country where only 8% of GDP is spent on health, but it is among OECD countries, which is a very rich, healthy country with long life expectancy. So Ayurveda has huge potential. Thank you once again, Dr. Hemant, for highlighting this. Let's move on. Now we have Dr. Jain, who will be speaking about Ayurveda medical education. He is currently working as a professor at the Department of Swasthya and Government Ayurveda College, Trivandrum, and he has 22 years of teaching experience at UG and PG level. He is also the chairman of Board of UG Studies at KUHS and SACRC, Government of Kerala. He's a great academician, a well-known public health specialist from Ayurveda. So Dr. Jain, please.
Thank you very much, sir, for the introduction. Am I audible?
Yes, you are.
Thank you, sir. Respected dignitaries and Ayurvedic lovers, doctors, dear friends. Let me begin by telling a sentence which we suggested a decade ago to Kerala government that time, but that project could not be materialized. That is, it goes like this. Ayurveda to Kerala is what petrol or oil is for the Gulf countries. Actually, Ayurveda is what you call a treasure house, in which by which we can go towards achieving our sustainable development goals. Actually, SDG is the prime motto behind this webinar also. How we can contribute towards a sustainable development through Ayurveda. What Ayurveda medical education can do is in 4 ways, I think we can contribute. One is, of course, through education, quality Ayurvedic education. That is what Ayurveda medical education would like to contribute. And the second thing is tertiary care. We have a very good, efficient Indian system of medicine department in Kerala. So the grassroots level, they do excellent job. And tertiary care can be provided through Ayurvedic medical college hospitals. And we have big hospitals in Trivandrum, nearly 700 beds are there. During olden times, even 1,000 patients were admitted at the same time. But now we are admitting only to the bed capacity. Tripunithura Hospital has nearly 480 beds. So such huge hospitals and tertiary care facilities are there, which can be utilized for the public. And also, if the government allows, we can treat foreign people also. And at the college level, we are involved in specialty care also. Just like modern medicine, actually we don't have super specialty departments here, but in Trivandrum College itself, we have specialized OPDs for neurology, for diabetology, for cardiology, specialized OPDs for hepatology or even liver diseases. Like that, specialized OPDs are running and patients are coming in. And also we have specialized clinics in infertility, especially related with women health and a lot of things, as our previous speakers were pointing out, related with the pediatric department, like which is called Kaumaraprati or Balachikitsa here. So such specialized care can be provided at Ayurvedic colleges, Ayurvedic medical colleges throughout Kerala. Now, not only government colleges, we have government aided colleges are there too, and also private sector is also there. So if we together, all this network together works properly, that can establish a well-equipped tertiary care system in Kerala for Ayurveda, especially for chronic ailment. NCDs and other things were discussed in the previous deliberations. So that is the second thing. And the third thing is research. And we know now the Kerala government is giving maximum support to Ayurvedic research. Recently, our School of Fundamental Research in Ayurveda was inaugurated at Tripunithura, and another research center is being noted at Kannur. When these two institutions come out, we will have a quantum leap in case of research in Ayurveda. And the fourth point is about training centers, actually. People were talking about Dinacharya, Rucharya and the protection of health through the individual through the individual involvement. Actually, health cannot be brought about merely by the individual responsibility. Health is a community responsibility as well. Ayurveda theories explain that very beautifully, that diseases can have two kinds of origin. One is due to the wrongdoings of the individual himself, like you might have heard, everybody are familiar with Vata, Pitta and Kapha. These imbalances happen due to the wrongdoings of the person. But take for the example of COVID-19, it did not occur because of the wrongdoing of a single person or 2-3 people. It happened due to a host of factors. Such diseases, such occurrences are referred to in Ayurveda as Janavadothamsas, mass destruction of people. The health events that cause mass destruction of people. So the reason for that is different. That is by a visheshan of Bhumi, Jala, Vayu, Kala, like that it is explained. So these two kinds of etiology, where in one, the person himself is responsible. In the second one, the community as a whole is involved, including the rulers to the common public. So that kind of an approach can be mooted by the academy, and it can be disseminated to the public through the network of Ayurveda colleges with the help of Ayurvedic teachers, Ayurvedic PG students and house surgeons and students alike. In case of COVID-19, we had the involvement of our students as COVID warriors as well. So I think in this four-pronged approach, through quality education, through tertiary care, through research, and through developing training centers based in Ayurveda colleges throughout the state, we can make a great network of or a platform from which we can have a quantum leap, where we can really work together with the ISM department, with the industry sector, and all the Ayurvedic enthusiasts together, so that we can move towards the sustainable development goals of the state in a meaningful way. Thank you. I stop here. because of lack of time. Thank you.
Yeah, thank you. Thank you very much, Dr. Jain, for those immense contributions, especially highlighting tertiary care, because I think the Secretary Ayush also, Honorable Secretary also highlighted that Ayurveda is often considered as primary care thing. So also I think the idea of community wellness training centers is very significant. So due to time constraint, we quickly move on. So we have Dr. Rajesh, who's a senior medical officer in the Department of ISM. He has 16 years of experience, and his works are quite well known, and he was awarded the Raghavan Tirunulpad Award in 2019. His visionary perspective has earned him opportunities to engage with various disciplines related to especially public health. So Dr. Rajesh Neelamana, please.
Thank you, sir. Hope I am audible.
You are audible. Very
Thank
clear.
you, sir. Thank you. Good evening, one and all. Feeling too much proud in this pleasant evening to represent the Department of Indian Systems of Medicine in this webinar. Due to time constraints, let me combine topics 1 and 2 together. Coming to the matter of health and wellness and NCDs. With the promotion of healthy diet and proper lifestyle, complemented with minimal amount of medicines, Ayurveda can effectively prevent the NCDs and their complications. The major strengths of Ayurveda in NCD management are, number 1, its holistic approach, the body-mind duo. Number 2, its upper hand in primordial and primary preventions. And number 3, the Shodhana Karma as a preventive and curative technique. And in detail, last few decades have witnessed an unprecedented increase in the NCDs around the globe. Lifestyle corrections like food and exercises, etc., are demonstrated as a panacea for this. But Ayurveda considers positive mental health equally important as food and lifestyle in the preventive aspects of both communicable diseases as well as non-communicable diseases. Ayurveda also stresses upon the body-mind duo in every aspects of prevention, curation, and rehabilitation. Another important strength Ayurveda having is Shodhana Karma. The purificatory treatment methods, the periodic purificatory treatment methods, which is widely used as a curative technique presently. But the preventive capacities of this technique is less explored. These practices are to be made people-friendly, practical, and popular to use it in the preventive side. And regarding the execution of these principles, many dispensaries under the Department of Indian Systems of Medicine is conducting special OPs for the non-communicable diseases, which are well accepted by the public. Jeevani, as mentioned earlier, a statewide pilot program for the prevention and control of diabetes and associated issues conducted in 2018-19 has shown significant results clinically. The current national program on NCDs, NPCDCS, that is National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Diseases and Stroke, is insufficient in many aspects. This can be effectively complemented by the primordial and primary preventive principles of Ayurveda, which can be efficiently disseminated through the Department of ISM through its 1,298 outlets across the state. On one hand, this improves the quality of life of the patient, and on the other, it reduces the disability-adjusted life years. Thus, by reducing the economic burden on the nation, such a program can definitely rejuvenate the Kerala Ayurveda and Kerala health model. Coming to the third and fourth topics, the palliative care and geriatric care. The holistic approach of Ayurveda towards health is very effectively used here. With special attention to the positive mental health of both the patient and the caregiver, we are able to do a fair job in palliative care through the projects implemented at local self-government levels. Maintaining digestive capacities, managing bowel issues, improving the sensory and cognitive domains, maintaining the physical and psychological equilibrium are the thrust areas of Ayurveda palliative care and geriatric care. Cognitive impairments and related mental health issues, which is usually neglected, is given due importance in Ayurveda palliative care and geriatric care. Coming to the examples of palliative care programs we have implemented, Snehathara, the state-run program in many of the Grama Panchayats, is still a big relief to the public. Punarnava, the post-stroke rehabilitation program run by the state, also has significant results both clinically and statistically. Project Susmrdam, a different one, implemented for the geriatric population in reducing the cognitive deficits, have shown significant results. Despite all this, Ayurveda has not been incorporated into the existing palliative care program at many of the Grama Panchayats so far. Anyhow, wherever implemented, it is well accepted by the patients and caregivers for the evident improvements in their physical and mental health and the quality of life, thus reducing the out-of-the-pocket expenditure of the public. Let me conclude. Behavioral correction is the first and foremost step for ensuring sustainability. It is too much an Ayurveda tool. No doubt, Department of ISM is having a very rich history of disseminating such highly sustainable health practices. Hence, it is very much capable to be the forerunner in this. It is capable enough to serve as the nodal center for Kerala Ayurveda and to place Kerala Ayurveda and Kerala Health supreme in the global health scenario. Thank you. Thank you, one and all.
Thank you, Dr. Rajesh, by sharing those very precise points of preventive public health programs of the Government of Kerala, and also highlighting the importance of the huge infrastructure that is available in the state. I would like to add that somebody should study what has been the role of preventive public health in supporting the long life expectancy in Kerala in the past. And I think there is no serious work on that. So with that, we move on to Dr. Raj Mohan, who's really the driver of this session and the panel. So Dr. Raj Mohan is currently working as the Associate Professor at the Government Ayurveda College, Trivandrum. And he's a technical committee member of the School of Ayurveda, School of Health Policy and Planning, KUHS. He's also the state coordinator of the State Ayurveda COVID Response Cell in Kerala. As the coordinator of the task force constituted by the Government of Kerala, he has designed the programs for implementation work of various Ayurvedic treatment programs for prevention, mitigation, rehabilitation of COVID in Kerala. So Dr. Raj Mohan, please.
Thank you, sir. Thank you, Dr. Unikrishnan. Good evening to respected dignitaries and all the delegates. Since it is, I think, due to the time constraints, I'm just coming to three major points I would like to touch upon. And the first one being, of course, the World Health Organization has proposed in its 2007 a traditional medicine policy and integrative health system that well incorporating the traditional medicine as well as the conventional medical systems together for some of the core areas. Definitely the major one being the geriatric palliative care as well as the NCDs that we are discussing today. And of course, Kerala is the primordial candidate for implementing these activities, because we are currently witnessing such activities in Kerala in the COVID-19 pandemic, in which there is a people-centered, decentralized and affordable Ayurveda care we are giving to each and every villages in Kerala. There is a proper implementation framework we have implemented. So by adopting this as a model, we have to move further. Instead of saying the word medical pluralism, we have to talk boldly on integrative health system. An evidence-based integration of Ayurveda into the existing framework is necessary for that. So we have to move towards that. So that is the first step, first point I have to make here. and we have to talk strongly about integrative health system. And the current status is being from tolerant to inclusive, not that much integrative. Some of the components we have already achieved, but some of them are not. And the second one is, I have to point out that in order to increase the trade potential of Ayurveda, as well as in order to increase the evidence-based approaches in Ayurveda, we have to have a transdisciplinary translational hub that has to be begun from the Kerala itself, within the Kerala, because Kerala has a lot of potentials in the traditional medicine research, in the herbal medicine research, because we have these a vast potential of vast array of herbal medicines, herbal drugs available here. So we have to strengthen our core competencies. We have strengthened the fundamentals, fundamental research by creating these kinds of transdisciplinary hub in Kerala, so that we can plan about much higher collaborations worldwide. Because without a proper hub, without proper translation research within Kerala, we cannot approach some of the major players of translation research worldwide. Definitely, Dr. Hemant is here. We have been in touch with the Shimane University, Japan, for quite a long time, and we are also talking with the Republic of Korea. And we have, of course, Dr. Unikrishnan sir is there in UN, and he's engaged in all these kinds of talks throughout the world also. It's a very nice thing. We can see that the government of Kerala, particularly our Sharmala madam is here, and our principal secretary and state mission director Divya ma'am is also there. And our health minister is also very peculiar in these kinds of collaboration. And we have two major institutions coming up in Kerala. The first one being the International Research Institute of Ayurveda. All the major work has started. It is coming in Kannur, Kerala. And one is under the Kerala University of Health Sciences. It is the School of Research in Ayurveda. We can have an academic element or academic components and research related courses we can conduct there. And not only these two institutions, we also need to combine some of the major institutions that are situated in Kerala. We have Rajiv Gandhi Institute here, we have CSIR Trivandrum is here, and we also have Kerala University here with multi-potential to do translational researches. And we have to combine all these things, all these institutions, and we have to start, of course, this translational and transdisciplinary, translational research of transdisciplinary nature, which is very essential for converting our principles into valid products, of course. And the third one is, of course, one of the dream projects Kerala government has initiated just now by visiting Japan and Korea, Overseas Research Initiatives of Ayurveda. I must say that it is ORIA, Overseas Research Initiatives of Ayurveda. Let us make it a dream, so that we have already talks on from UK and already talks on. Dr. Madan Tangavelu, probably he's listening to this talk from UK. And also we have European Union, Germany is there, of course Japan, Shimane is already there. So we have to initiate some overseas collaborations that will probably increase the trade potential of Ayurveda. Currently, I think 48 countries recognize the presence of Ayurveda in their soil, and 6 countries are having Ayurvedic pharmacopoeia in India as their herbal drug pharmacopoeia. So there are so many positive things happening around us. So let us hope for the best. With these words, I conclude my this small talk. Thank you so much. Thank you so much for being here with us. Thank you all. Thank you.
Thank you, Dr. Rajmohan, for eloquently sharing those thoughts. I think Ayurveda should move not as standalone, as integrative. That's what you highlighted. And the Niti Aayog is now discussing One India, One Health approach. And it is almost in the concluding session of report making and so on. So I think there is a lot of hope at national level of more integrative approaches to health and healthcare in our health systems. So with that, due to time constraint, I'm not able to go back to each of the panelists for final comments, but let me just take 2-3 minutes to conclude what we have learned through this very rich panel discussion. So the National Ayurvedic Mission, State Mission Director, Dr. Divya here pointed out the richness of the biocultural diversity in Kerala, how rich the medicinal flora is, and how it can really contribute from household level to more complicated levels of Ayurveda integration and community to institutional care. She also highlighted how it has been an intergenerational knowledge and how it has been preserved and it has been transferred so dynamically. And she highlighted the point of COVID pandemic and so on, and what is the presence of Kerala Ayurveda in the global reach in the 48 countries. And she also called for personalized, pluralistic, bar integrative system of health. And that is very significant. And the different panelists shared various experiences. I wouldn't want to repeat those. But what, in general, I have 4 points to share. What I feel is from all these technical presentations this afternoon and evening, it looks that we have extensive experience both in terms of institutional care and community care, but there is limited experience. So it can be clinical as well as public health approaches that we have heard this evening. We have had thoughts on Jeevani, Prasadam, Punarnava, etc. But the documentation seems to be quite limited. So I think we need to have really a robust documentation of all of these projects. If you look at the clinical trial registry of India, there are close to 170 studies registered from Ayush sector. And if you look at the presence of Ayush sector in those studies, there are 2 studies from the homeopathy. There are 2 national studies implemented in Kerala. And there is a Sinjivar study which is happening in Kerala. But apart from that, there is hardly anything registered on CTRI from Kerala. And I just want to drive at the point that we need to move a lot on the research direction. And this also extends to a larger point. I was looking at the data of last 20 years and Ayurveda's contribution to public health in Kerala. And there are claims that in chikungunya and dengue and so on, there has been a lot of experience and there have been government programs from the ISM department. But if you look at the documentation, it's clearly limited. So what I just want to say is that just to reconfirm what Dr. Rajmohan said, there are transdisciplinary projects in terms of Ayur biology and so on. We heard them in the previous technical session. So we need to, in the COVID situation, we have seen how robust the Kerala response has been. So I think in infectious diseases, nutritional disorders, and lifestyle disorders, there is much to be documented. And we need to develop international and national collaborative projects. And JNT, BGRI, Rajiv Gandhi Center for Biotechnology, all can be partners in that. And we need to even maybe propose a WHO collaborating center in Kerala. There are already 2 in India working on Ayurveda. The second point that I want to highlight is that I have been looking at the health system of Kerala and the past 3 decades of literature. In the 1980s, there is a lot of literature that highlighted the public health significance of Kerala's good health at low cost. There was a Gunathilake study from WHO and several other studies. And from within Kerala, like Professor Raman Kutri, from CDS and Achyuta Center, there have been a lot of studies. But what is striking is that the contribution of Ayurvedic sector in the public health system and the life expectancy in Kerala is hardly documented in any of these studies. And so that is the second point. We need to clearly look at what has been Ayush and Ayurveda's contribution to the public health scenario, right from household practices to the institutional care. And that's a serious research project indeed. And then we have had the third point is about innovation and global linkages. We have had a presentation from the Ministry of Ayush about the various MOUs signed and the different chairs in foreign universities. Almost 25 countries Ayush department is having presence in now, and there are 13 chairs abroad. So, and there are organizations like the Research Information System for Developing Countries, which is a think tank at the ministry, under the Ministry of External Affairs. They have worked especially with BRICS countries, Brazil, Russia, India, China, and South Africa. They have created the BRICS Wellness Index. The ICRIER, which is another think tank in Delhi, has worked with G20 countries. So these are all explorations which Kerala Ayurveda should really make. And I think reaching out to the CRO countries, Southeast Asian region countries, and other countries like Africa and Latin America. Currently, the presence is more towards Europe, but I think we need to go south. So there's a lot to do with South-South cooperation. The last point that I want to make is that In the 80s and 90s, if you look at the sociology literature, the heritage study literature, there is much written about the traditional and intergenerational transfer of Ayurvedic knowledge in Kerala. Francis Zimmerman, Frederick Smith, several scholars from European and global universities have done that. There are heritage studies of spice route trade. Much has been written about Hortus Malabaricus. So outside the health system, also in the sociology and anthropology, heritage study domain, there is much to offer from Ayurveda in Kerala. I would like to just conclude by saying that I think Ayurveda should take benefits from such studies. It will be really useful for further developing such studies through, as Dr. Rajmohan said, and Dr. Warrior and all other panelists spoke about interdisciplinary research collaborations. So once again, due to time constraint, I would like to thank you, Dr. P.M. Warrior, Dr. Hemant, Dr. Jain, Dr. Rajesh, and Dr. Rajmohan for the rich contribution. It has been such a privilege for me to chair the session. Thank you also to the organizers to inviting me to moderate the session. All the very best. Thank you very much.
Thank you, sir. And that was indeed a great discussion. We hope that the delegates have been greatly enlightened by this learning and knowledge sharing process. Now we request Dr. Sharmila Mary Joseph, co-chair of the webinar, to conclude the webinar and give her thoughts on the way forward for future activities. Ma'am, please.
Good evening, friends. Good evening, delegates. So we have had some detailed discussions and interesting presentations over the course of the last 3 hours. The webinar basically focused on themes like the role of Ayurveda in health and wellness, its impact in the management and prevention of non-communicable diseases, the role of Ayurveda in geriatric care, and the role of Ayurveda in pain and palliative care. Speaker after speaker highlighted the importance of the personalized approach and the holistic approach that Ayurveda has adopted and adapted in looking at patients, in treating patients, in examining their various symptoms, and in coming up with solutions. The Kerala model of public health delivery, the Kerala model of public health service, has rightly adopted these basic principles in ensuring that the people of the state have access to good quality treatment, have access to good health care, have access to primary health care services right at their doorsteps. So it is because of this socialistic approach of the successive state governments and the decentralized planning and implementation process that today we have the health centers, the health dispensaries of the modern medicine and the Ayush sectors, catering to the requirements of the population at large. And as I mentioned in my earlier presentations, the state public health centers, the primary health centers, have been transformed into family health centers. And the next aim of the government is to transform the primary health doctor to family health doctor. The state rolled out the Ardram mission 5 years back to expand the scope of the primary healthcare services in the state. And as part of the Ardram mission, not only the primary healthcare centers have been transformed, have been changed to family health centers, the infrastructure in the secondary and tertiary care centers have also been strengthened. And we have today the latest and the most modern medical equipments right in the taluk hospitals and the district hospitals. So this would reduce the burden, the pressure on the tertiary care centers. So along with that, the state has also embarked on strengthening of the Ayush sector also. So this coupled with the support from the National Ayush Mission, we have, a large number of programs which are aimed at improving the primary health of the population at large. A large number of schemes are being implemented, like Ayush Grams and Ayush Holistic Centers and Ayushman Bharats and projects with similar names, where patients who come to our health centers are looked at holistically, and the primary care, the primary health care, which is basically the preventive health care, is given utmost importance. So in the Our Health, Our Responsibility campaign initiated by the state government last year, the focus was given to 5 main areas: the healthy eating, healthy living, health-seeking behavior, maintenance of personal hygiene and environmental sanitation, and abstinence from alcohol and drug abuse. So this, principle of healthy living, of our health being our responsibility, guides the primary health approach of the state government. So now, when we look at what is to be done in the coming years, or what is to be done to improve and sustain the results that we have obtained in our health indicators, the results that we have obtained in the various parameters of healthcare, what we need to do is to ensure that, whatever is being done is based on sound, solid evidence. So it is with this in mind that the data that we collect as part of the various projects, as part of the various schemes, as part of the various programs that we implement, are analyzed systematically, are studied systematically, and also evaluated systematically, so that future activities can be tailored around the findings that these studies throw up. So it is with this in mind that the state government has decided to establish an international research center, a research institute in the state at Kannur, for which the initial groundwork is being done. So research cannot just be restricted to one international research institute. Research and research-oriented activities have to happen across the various institutions, across the various hospitals and dispensaries that we have. So our physicians, our clinicians in the Ayush sector have to, sort of modify their activities, have to sort of tune their activities to a research-oriented approach too, so that the information that they gather can be, put in a proper framework, and the evidence from the framework will form the basis of future policy making and future policy drives of the government. So as we embark upon this journey of transforming Ayurveda as an individualized, evidence-based system, we need to, set the table straight. We need to go back to the drawing board, the planning board, the planning center, so that every institution has its goals and targets clear. Every institution has its specific assignments and responsibilities clear. Collection of data, collation of data, interpretation of data, and then building up the data so that a model can be worked out. And this can also be achieved by, collaboration with academic institutes, both within the Ayush sector as well as outside the Ayush sector. So that is what we mean by, integration, and that is what we mean by an interdisciplinary approach, where our research, our studies, our analysis would be combined with similar work or scientific work being done at science research institutes, at other disciplinary institutes. People have been mentioning about the collaborations that could be worked out with CSIRs, with ICERs, with Indian Institute of Science, other universities. Yes, we need to build upon that, because only if we support our data with solid scientific background can the data have any value and relevance. And only then will the data be accepted by the scientific community, not only in the country, but also the scientific community abroad. Then the next main area by which we can, give the brand Kerala Ayurveda more authenticity is by ensuring that the treatment modalities and the approach towards patients in our centers follow the highest standards, meet the quality benchmarks that we have set. See, we are transforming our institutions into institutions which conform to CASH standards, the Kerala accreditation standards for hospitals. So as we change, or as we ensure that our institutions reach these standards, it is our responsibility, or it is a responsibility of the physicians in the Ayush sector as a whole, to ensure that the treatment that is given to the persons coming into our centers also meet the highest standards. See, Ayurveda health and wellness programs are given not just through our Ayush institutions, but also through various resorts and various institutions under the hotel and tourism industry. So even though we have not actually probed into or looked into the quality of the standard of the health and wellness packages that are being offered through such resorts or through such tourism institutions, there is already some kind of branding and already some kind of rating, some star rating that has been fixed by the tourism department. But the Ayush department also may need to look at that little more closely, so as to ensure that the health and wellness packages conform to the highest standards, and so that more visitors, more travelers will come from different parts of the country as well as abroad to make use of the services that our agencies offer. The next area is to augment the Ayurveda-based medical trade and Ayurveda-based herbal drug trade. We already have one Aushadhi in our state, which manufactures quality Ayurveda medicines, and Aushadhi also sends medicines to other parts of the country. I was recently in Aushadhi, so when I was just checking up with them whether they have, they get orders from abroad, the reply that I obtained was that these are Ayurvedic medicines do not come under the drug regulatory standards of the different countries. Perhaps some of these Ayurvedic medicines are being sold as nutraceuticals and cosmetic products abroad. But if we need to ensure a better market presence, we need to identify those areas in the international trade agreements or in the trade policies of different countries as to how we are able to, or as to how we will be able to access the market, access the foreign market. Because if people come here for treatment, people would definitely like to buy our products at their own countries, at their places of residence also. So transdisciplinary collaborations, yes, I mentioned that. Then the richness of Kerala flora, we had mentioned in the previous presentations also. Now we are also embarking on this program of increasing the area under medicinal plant cultivation. We already have large number of medicinal plants growing in our state, but we need to focus a little more on that in collaboration with the Agriculture Department and the local self-government department, so that, this is developed on a greater scale. And as we develop this on a greater scale, as we develop more medicines, as we extract more preparations, more more medicines from the plants, we can also explore whether we can, move for patent for some of our products. So these are some of the thoughts that I would like to leave you with this evening. It's already getting late, so we need to go back to our policy table and to work out, strategies for transforming Ayurveda into an evidence-based system. We need to work out policies for creating globally acclaimed empirical models for geriatric palliative care and NCD management. We need to promote Ayurvedic-based medical value tourism. We need to augment Ayurveda-based medical trade, herbal drug trade, and we need to ensure that collaborations are built with national and international universities of repute, and that some of these collaborations are translational, transdisciplinary, and interdisciplinary. So with that, I will wind up here. And do we have a formal vote of thanks or? Okay, so I would also like to place on record my thanks to the Honorable Minister Health, who inaugurated the webinar. My thanks are also due to Secretary, Ministry of Ayush, Vaidya Rajesh Koteja ji, for sharing his thoughts. Our sincere gratitude is also due to Mr. Pathak, Additional Secretary, Government of India. I would also thank all the panelists, all the speakers who spoke at the scientific sessions, all the panelists who shared their thoughts, their ideas. So we would build up on those thoughts and ideas to strengthen the sector and to give Kerala Ayurveda a more authentic name, a stronger name, a more authentic name. And I would also like to thank all my officers of the Ayush department, the NAM, the officers from NAM, the officers from ISM department, from Directorate of Ayurveda Medical Education, the technical team, the scientific team. Then I would also like to thank IT Mission and CDIT and the startup company which was doing the online live streaming. So my thanks are due to each and every one of you. Thank you. Okay, so we'll declare the webinar closed, and we would have organized similar webinars in future too. Okay, thank you. Bye. So thanks to all of you.